Okay, councillors, just going to give you one minute to make sure you get seated. Good evening, all. You're all very welcome to the Fermanagh and Omagh District Council Policy and Resources Committee meeting this evening, Wednesday, the 15th of March, 2023. I'm chairing the meeting from the Grange, Omagh, and there are other councillors on via WebEx. There are several councillors here in the chamber in the Grange also. I'm joined at the table here by the Chief Executive, Alison McCullough, other heads of service, and the Democratic Services Manager. Just trying to sort out our IT issues there. Okay, we're back on here. Thank you. So we're going to welcome everyone, and especially our councillors and officers, the press, and the members of the public who are joining online. Just a couple of prelims before we start. As the normal practice is, please respect the chair and each other, and the 3-minute rule will apply. We have quite a lengthy agenda, quite a number of topics in it, so we ask for your cooperation throughout, and hopefully we'll get this meeting completed as we're running out of time in our council term here. We have 8 reports and 15 items of correspondence, most of it's for noting. The way I've situated it tonight is that we're after matters arising, which is, after item 3, we will move to item 5 and take on the reports, and then it will be straight through, including part 2 business. Then we will move back to item 4, which is matters arising, to deal with that. Councillor Debbie Coyle has indicated that she wants to raise 3 items of any urgent and relevant business, which I've agreed to, time permitting. We'll see how we get on. So it is now 3 minutes past 7. Thank you. On to item 1 on our agenda, and it's apologies. And I now go to the group leaders. First of all, we go to Councillor Tommy Maguire, Sinn Féin Group Leader. Trying to get you on here, Tommy. Sorry, we seem to have a problem here. Trying to. Please bear with us. Okay, over to you now, Councillor Maguire.
Thank you, Chair. It's a three-area own group of Sinn Féin and up to Corleary, Patrick Withers, Anne-Marie Fitzgerald and Catherine Kelly. 3 apologies for the Sinn Féin group and Councillor Withers, Fitzgerald and Kelly. Kelly. Thank you, Chair.
Thank you, Councillor Maguire. On now to the Ulster Unionist Group Leader, Councillor Victor Warrington.
No apologies from our group tonight, Chair.
Thank you. Now on to Democratic Unionist Party, and it's the group leader is Paul Robinson. It's Paul Robinson.
No apologies, Chair, from the Democratic Unionist Party.
Thank you. Now to the Social Democratic and Labour Party, SDLP, Councillor Mary Gardy.
Thank you, Chairman. To apologies, Councillor Blake and Councillor Gannon, and best of luck on your meeting tonight, Chair. Aaron.
Thanks very much, Councillor Gardy. Thank you. And now Councillor McAleer is indicating via WebEx independence.
Thank you, Chair. Yeah, I just have the one response from Councillor Josephine Deehan, who will be attending. Just she's another meeting at the same time, and she's just going to be slightly delayed due to attending it, but she will be attending a wee bit later. Thank you.
Thank you. Thank you. I think that's apologies. Now, item 2 is to sign the minutes, confidential minutes of the previous meeting held on the 15th of February 2023, and they've already been signed. On to item 3, and it's declarations of interest. Chief Executive.
Thank you, Chair. If I could make a collective declaration of interest on behalf of all staff in relation to the various items regarding pay, correspondence for those on various scales. And secondly, Chair, personal declaration of interest in the confidential staff matters report, item 11.1, and I leave the chamber during consideration of that item.
Thank you, Alison. Now we're going to item 5, and it's reports for decision. Okay, and it's item 5, and it's a report of consultations, and we go over to Louise Horner, who's online. Louise.
Okay, thank you, Chair, and good evening, members. Can you hear me okay?
Yeah.
Okay.
Carry
Okay,
on.
thank you. Members, this is the this report seeks members' approval for the draft response. Firstly, for the draft response on the consultation of temporary suspension of emergency general surgery services at the South West Acute Hospital. And I'll cover that first, and then I'll come to the items for noting. So the draft response, which is attached to Appendix 1, is the Council's draft response, which is we've consulted with all elected members and the Disability Advisory Group to the Trust's consultation on the suspension of EGS. So the response covers the following. We've set out that the Council has major concerns with both the process and the content of the consultation, and that this is likely to be the start of a process that further diminishes the services offered by the SWA to residents of and visitors to the district. So the main concerns are, firstly, that the consultation was issued after the decision was made to temporarily suspend EGS and does not include any options nor provide any rigorous cost-benefit, cost-effectiveness, nor value for money analysis. The suspension of emergency general services negatively impacts rural residents within the district. Thirdly, the number of patients impacted is unacceptable, and the number of those with disabilities are unknown. So we estimate 1,800 patients per year. Fourthly, that timely and equitable access to services are sidelined by the assumed efficiencies of centralisation and rationalisation. That there is a lack of robust evidence for how the decision will impact patient outcomes. That patient safety is threatened by increased transfer times. The review and the overall review of general surgery in Northern Ireland was completed without consultation at a local level, so that the impacts of implementation of the standards was not fully explored. So, then that the equality of access and rural needs have not been met, and that existing health inequalities will be made worse. that there is also a misalignment of health and social care trust areas across Northern Ireland, and that the poor retention and recruitment of staff suggests a failure of management. At 2.1.4, there are a number of potential solutions, or I suppose rather asks of the trust by the council. Firstly, a public commitment from the trust that emergency general surgery will be reinstated at the SWA by the end of 2023. The expansion of the hospital travel cost scheme to all patients who are affected, currently it's effectively means tested. That the trust advertise for consultant surgeons to the SWA and not exclusively to Alton Galvin. That the trust identify surgical specialisms that would attract junior consultants to the SWA in consultation with medical professionals. That the Department of Health gives consideration to a separate trust being established and to take decision making away from the trust for the SWA, and for this model to be clinically led. A formal declaration from the trust as to the available beds to deal with the transferring of patients from the SWA in each of the pathway hospitals, and ask that the trust provide patient data by disability, that the trust conduct an independent impact evaluation of the removal of emergency general surgery, and to put that in place, and to produce a costed options paper of potential solutions. Then that the trust established that they published their initial equality screening matrix originally completed, and finally there is full transparency of monitoring data collected by the Department of Health. So members, seek the approval of this draft response. Thank you.
Okay, thank you very much, Louise. And can I, at this juncture, commend you and your team for all the work that you put into this. So there's a lot of work was on there, so I want to commend you at this stage. Okay, we'll go down to the chamber now, and we have Councillor Rosemary Barton.
Thank you very much, Louise.
Just pull it a wee bit closer to you there.
Thank you very much, Louise, for the hard work that you've put into this, and it's very well documented, both our reasons for not accepting our reasons for disagreeing with some of the actions taken by the Western Trust. You looked at potential solutions, and you give a list, quite an extensive list. I'm wondering, is there room for adding that we would be willing to facilitate members from our patients from Belfast that wish to travel down, or that we could have some sort of surgery in the SWA to facilitate patients from Belfast travelling down rather than travelling the other way?
Okay, do you want to come on there, Louise, on that? Thanks, Councillor Barton.
Thank you. I mean, I think that would be a possible solution, but I think it may be that it just puts another set of patients or potential patients at additional, in terms of travelling additional distances. And I think what we're trying to argue here is that, irrespective of whether there is a medical case for the concept of the golden hour, that there is just a profound inequity in terms of what this decision has led to, which has put so what's it, 77% of residents within Fermanagh and Omagh over an hour out of reach of emergency general surgery. So I think from an equity point of view, I think this is what the heart of this response is trying to say, is that this decision has disadvantaged the residents of this district.
Okay.
Okay, happy enough there, Councillor Barton. Right, back to the chamber again, is Councillor Victor Warrington.
Thank you, Chair. Well, again, thank you to Louise for putting the work into this consultation. It's obviously one that's affecting our whole council area, and especially maybe those people more so in Fermanagh. And certainly, as has been seen recently, we're very much up for the fight to get our emergency surgery restored into the SWA. So with that, I would like to propose the consultation goes forward. And again, thank you to Louise for preparing it.
Okay, your proposal, Councillor Warrington, thank you. And we go to your party colleague via WebEx, and it's Councillor Diana Armstrong.
Good evening, Chair. Thank you. And thank you, Louise. It's an extremely thorough report. And I really note as well the bibliography that you have referenced all your sources, something that the Trust failed to do in their consultation documents. So I think it's very impressive. It's very, very thorough. And thank you for including a point that I had made, and I raised it again on Monday night to the SOAS group, is in page 12, where you have the ageing population in Fermanagh being estimated, the over 65s, and we have the data there, 22% of the population by 2030 and over 25% by 2040. The 25% would represent over 30,000 people. And also, its consideration needs to be given to the hinterland of Athnagelvin. That ageing population, Louise has very kindly investigated that. So that would make up to nearly a quarter of the Derry City and Strabane population there. So it's the robustness of Athnagelvin to cope with that ageing population and our ageing population together collectively, and the strain on Athnagelvin to provide equitable service, which concerns me, and Louise has put it forward very well. So thank you, Louise, for including that. I think it's something very, very important, and something to be borne in mind as a threat to the health of the elderly, vulnerable people in our district. Thank you, Chair.
Are you happy to second?
I will, yes, Chair. Thank you. Yes, I will.
Okay, a couple other councillors coming in here. Gonna go to the chamber now is Councillor Paul Robinson.
Thank you, Chair. Just like to thank Louise for the work she put into this year. It's very well done and supported. I was coming in to second it, but it's already done. So thank you, Chair.
Okay, thank you, Councillor Robinson. Think about this game here, you need to be quick to the mark. So back to the WebEx again, we have Councillor Emmett McAleer.
Thank you, Chair. No, I think the points are well made, and I'm not going to rehash them now. I'm glad to hear some of the local reps speaking up there, and I think it is very important that we do put in such a strong response to this consultation, and hopefully some heed will be paid to it. I'd just like to raise another query that's under the same agenda notes here. We have obviously on page 3, it lists some of the forthcoming and upcoming consultations.
Sorry, Councillor, we're dealing with that consultation first for decision, and then we're going on to the rest of it, if you don't mind.
Oh, that's 100%, Chair. Happy to come back in then. That's all right.
No problem at all. Councillor Swift, via WebEx.
Magad Cahirlock, and good luck on your last night meeting of PNR, and moving swiftly on. I just want to thank Louise very much for her extensive work in providing this all-important response to the emergency general services, and I have to agree with everything that has already been said, especially by Diana. It's an extensive report and very well appendixed with the bibliography and referring to your research done for and on behalf of all of us who are representing our constituents in this dire case. And I want to further thank you for expressing explicitly as well the issue on the golden hour. It was a question I'd asked the Chief Executive to ensure it was included, and it's done, and it's very well done, because we all know the question was asked at our subcommittee and further responded by Dr. Lavery that the golden hour was an 80s concept, but didn't actually elaborate it or explain explicitly what he meant by that. And I'm glad that our response explicitly states, you know, we want to see patients receive definitive care within 60 minutes from the occurrence of injuries, after which mortality significantly increases. It's stated clearly on page 7. Louise, thank you for that. Because it had been suggested by the personnel that we had met that that was no longer relevant. But it's a concept which has been in place, as you have said, since the First World War and was utilised by the health professionals that time. So it cannot not be relevant, and the other studies state the same. So as a rural elected representative representing the people who live the furthest away from any of these services, it's imperative that we are making that point, and the point is well made. And all of the campaigners were very concerned about this very issue as well. We heard it at every public meeting we attended. So I too am very happy and want to concur with the supporting of the recommendation going forward. So we look forward to all of our services being saved here for on behalf of our rural constituents. Thank you very much, Chairman.
Thank you very much, Councillor Swift, for that. There are no more speakers at this stage. So it has been proposed by Councillor Warrington, seconded by Councillor Armstrong for the adoption, and that is really on item 2 of that for decision. So are we all agreed? Okay. Now we move on to the second part of it, and back to Louise to take us through the key issues for information. Louise.
Okay. Thank you. Thank you, Chair. So this is the recommendation at 9.2 that the Council notes the additional information presented on. Firstly, forthcoming consultations to which an officer response will be submitted due to the pre-election period, and this will be a consultation response on the draft Domestic and Sexual Abuse Strategy 2023-2030. Forthcoming consultations for information only. A consultation on UK policy on managing radioactive substances and nuclear decommissioning. And secondly, prohibition of rating bus for the Belmore Street and East Breed Street, Enniskillen. Forthcoming consultations refer to other council departments and colleagues for technical consideration. And this is the design considerations for renewable electricity support scheme for Northern Ireland. And finally, consultations submitted since the last Policy and Resources Committee, which was the response to the consultation on the draft autism strategy.
Okay.
Members are asked to note.
Thank you, Louise. A couple of councillors come on here, and bear in mind, please, this is for information. Okay, first up, via WebEx, we have Councillor Emmett McAleer.
Thank you, Chair. Now, again, I'd start off by welcoming the Council's intention to respond to the consultation on the draft Domestic and Sexual Abuse Strategy. I think that is hugely important, and obviously it is something that I'm quite proud that the Council has been very proactive on to date and has been leading on. So I would hope and trust that it will be a fairly strong response we will be submitting. I would, however, noting that we're sort of leaving it to individuals to respond to the consultation at 3.2.1, which deals with managing radioactive substances and nuclear decommissioning. I would actually propose that we do submit a response to that as a council. I was reading through the 2 associated documents that are linked to this, and there seems to be conflicting information contained within them. Obviously, radioactive and nuclear energy isn't something that is produced in the north, but unfortunately there seems to be an undercurrent that somewhere down the line, wherever it may be, and I know there are, I believe, 4 different locations cited as potential dumping grounds for nuclear waste due to a previous government white paper. I believe 2 of them possibly within our own district. But I would suggest that we do make a response, even if it's so much as to say that we as a council and as a district area are not supportive and do not want to see the dumping of any nuclear or radioactive waste anywhere, not just in this district, but again on the entirety of this island, which, as I say, doesn't produce or use any nuclear or radioactive energy. So I would make that as a proposal, Chair, and hope, even if it's a brief response, that we do submit a response along those lines. Thank you.
Okay, thanks, Councillor McAleer. I'm going to bring in the Chief Executive to clarify a few issues on that one. Thank you.
Well, no, Chair, maybe just to say, as members will be aware, this is our final meeting, so our own internal resources reallocated towards election preparations. So we simply don't have the capacity to respond to consultations in detail. However, if Councillor McAleer is proposing we send by way of, for example, a letter just setting out the Council is opposed to any proposals regarding the dumping of nuclear waste on the island of Ireland, if that is the agreed position, that we could certainly submit that, but it wouldn't be a response to the consultation per se.
Happy with that, Councillor McAleer?
Chair, yeah, just very briefly to come back on that. Having read through the consultation questions, I'm more than happy that a response as noted by the Chief Executive is submitted along those lines. So yeah, no, I'm happy enough to propose that. Thank you.
Okay, thanks for that. On to WebEx again, and we have Councillor Bernice Swift.
Yeah, and thank you again, Louise. And it's just on 3.1.1, the consultation draft on domestic and sexual abuse strategy. Having attended the recent Women's Aid conference detailing where the blame lies about domestic abuse and sexual abuse, indeed, for all women sufferers. We heard extensively from the survivors on the day, and I feel strongly that those of us who were in attendance at that conference, we were fully informed of the seriousness and the changes that definitely need to take place where women especially need and must be protected. And I hope that our consultation to this will help that within the Department of Justice. Interesting again today at today's reception that the Councillor McElduff held for the helping children and women also in that field. It is interesting to hear as well about the coercive control and how it impacts every single stratosphere and the complex needs of women thereafter suffering with this ongoing abuse and the lack of judicial response to the same. So women basically are suffering in silence, and when their voices aren't heard, it silences them even more. So again, equitable response is needed on all cases, and especially speaking up for women here tonight. So thank you very, very much, Louise, for all.
Thank you, Councillor Swift. And again, sticking on WebEx at this stage, Councillor Mark Buchanan.
Thank you, Chair. Just a related query very quickly. It was just brought through an AOB there at the council meeting around the pre-consultation on the school in Kilskeary. I don't see that just mentioned on that list. This will be within the sensitive period as well, but just it would be very important to have a council response stating our objection to that closure. And I know members can do it individually as well, but just to check that that's in hand. Thank you.
Thank you, Chief Executive.
Yes, Chair. No, just to confirm, Councillor Buchanan, yes, but we're doing that by form of a letter as agreed to the department and to the various education authorities, as opposed to the consultation will then trigger subsequently. So we're doing that in the form of a letter. I think it's already issued, actually.
Thank you. Back in the chamber now, and we have Councillor Eamon Keenan. Switched on here. Where?
Yeah. Correspondence, yeah, happy enough to second Councillor McAleer's proposal there on the radioactive waste.
Thank you. Okay, you're happy enough for that. Thank you. And the chamber again, we have Councillor Tommy Maguire.
Again, in response to the radioactive substance and nuclear decommission, if it could possibly just included in the letter that for many years now, the former Fermanagh District Council certainly is a member of the All Ireland Anti-Nuclear Group, or Nuclear Free, I believe, and I think we have a representative on it. If that could just be reiterated within that since 1985, when I was the representative on the All Ireland Group, Nuclear Free Group myself. So it's a long-standing position of this council and the former council that we have a representative there.
Okay, Councillor. Yeah. Councillor Buchanan, can you lower your hand, please? Thank you. Okay, you've heard the proposal by Councillor McAleer, seconded by Councillor Keenan. Are we all agreed on that one? And subsequent comments from Councillor Maguire. Okay. And then item 9.2, and this for the information. Can we have a proposer and seconder for all that information? Councillor Crawford, Roy Crawford in the chamber proposes, seconded by Councillor Tommy Maguire. Are we all agreed? Thank you. Okay, we're on to agenda item 5.2, paper B, and it's financial matters. And now we're on over to Catherine, Head of Finance. Catherine.
Thank you, Chair. Members, good evening. The paper B includes matters for decision and matters for noting. The first item, members for decision, is an update or a policy review on the travel and subsistence policy for staff. And it's attached at Appendix 1, and also attached as an appendix is the equality screening matrix and the rural needs impact assessment. And members, just to note that the updates in this policy primarily relate to and reflect the Council's climate change and sustainable development strategy, and in particular the use of, or the increased use, still very small numbers by staff, of electric vehicles. At item 2.2, members, you may recall at the special council meeting in relation to setting the estimates for 23-24, consideration was given to the price increases for service delivery and goods supplied by the council, and they are attached in detail at Appendix 4, and they are based on the entire council directorates in relation to a full policy report on pricing. And then, members, for noting in section 3 are the district rate tables for NI for 23-24. Associated with that, then, the Department for Communities has also recently published rate statistics for all of the councils, and for both of those documents the links are attached within the paper. And finally, for noting under 3.1.3, members, is the regional rate for the year ending the 31st of March 2024, which was set by the Secretary of State. And again, members, the link to that legislation is attached. Subject to any queries, Chair, that the Council approves the updated travel and subsistence policy for staff, the service pricing model as detailed in Appendix 4, effective from the 1st of April 2023, and notes the district rates and related statistical information updates for NI councils and the regional rate set for the 1st of April 23 by the Secretary of State. Thank you, Chair.
Thank you very much, Catherine, for that detailed report. Okay, there's 3 parts to the recommendations, 2 A and B for approval and C for noting. Councillor Warrington in the chamber.
Thank you, Chair. I propose the recommendations as listed.
Thank you very much for that. And now Councillor Alan Rainey, MBE, in the chamber.
Happy to second that, Chair.
Okay, it's been proposed and seconded. Councillor Emmett McAleer via WebEx.
Thank you, Chair. Now, having read through the documents and I suppose the attached documentation in terms of, I'm just having a bit of a problem loading it up here, in terms of the noted price raises, I think, if I can just get the screen here. Bear with me, my PC has just stopped working there. No, just in relation to the noted price rises, I do have to note that, you know, by and large, you're talking across the board there. So quite a number of raises that you're looking at 10%, 11%, which obviously is reflective of inflation. But at a later document, which we will come on and discuss further, I suppose you're looking at a relative pay increase noted for staff of 3.8%. So given that disparity and the times we're living in, I'm not sure how we can condone such a pay rise or such an increase in prices. So I'm going to have to voice dissent on this particular issue. Thank you, Chair.
Okay, you're dissenting. That's fine. Thank you. Okay, it's been proposed by Councillor Warrington, seconded by Councillor Alan Rainey, MBE. The recommendations as listed. Councillor McAleer has dissented. All agreed otherwise except for Councillor McAleer? Okay, great. Thank you. Thanks for that, Catherine. On to item 5.3, and it's to consider a report on financial reserves policy, paper C, and again, it's over to Catherine, Head of Finance.
Thank you, Chair and members. In relation to the workings of the 22-23 estimates and the 23-24 estimates, members will recall reference in a number of those documents to a council financial reserves policy. So glad to have now reached a draft on that, members, presented to yourselves tonight. And the policy has been developed to support the council system of good financial governance and to assist in effective financial management. And it has been developed in compliance with a range of relevant pieces of legislation, regulations, good guidance, support and practice, and codes of practice. And the policy covers the role of the Chief Financial Officer, and that's Alison herself in that role. The sources and types of reserves, and we'll refer to the usable and unusable reserves in more detail within the policy. The adequacy of reserves, including the principles used to assess the adequacy of the reserves, periodical reviews and the use of reserves, and importantly, a reporting framework on the use of those reserves. The policy as well then is supported by an equality screening matrix and a rural needs impact assessment. And Chair, subject to any queries, the recommendation is that the Council approves the financial reserves policy. Thank you.
Thank you very much again, Catherine. Okay, under the chamber we have Councillor Eamon Keenan.
Thank you, Chair. Yeah, just on the financial reserves policy, the draft financial reserves paper C, I'm getting a message when I try to open it up that I'm not authorised to view this document. Yeah, it's like a little red box. You can't open the paper.
Okay. Right, any other queries in the meantime? No? Okay, Councillor Keenan's having problems getting into this document. We're just checking that out now.
All right, thank you.
Getting it at the top table, I don't know. Can anybody else check that out there?
Chair, I can see all of those documents. Anne-Marie here.
Refresh your browser. Thanks, Councillor Donnelly.
Chair,
Okay.
just for reference, that was the same issue I had on the previous issue, even though I was looking at it moments before when I went to click on the attached paper. It crashed as well, but it does seem to be working again now.
Okay, right. Okay. Any other comments on this? Or can we have a proposal and seconder for the adoption? Okay. Councillor Paul Robinson in the chamber.
I propose adoption of it.
Seconded by Councillor Alan Rainey, MBE. We all agreed? Thank you. On to item 5.4, and is to consider the report on procurement and tenders update, and it's paper D. And so we're again to Catherine, Head of Finance.
Thank you, Chair. There are a number of items for decision, members, in this paper, and I suppose reflecting that there will be no Policy and Resources Committee meeting in April and May, so we're seeking approval. It's quite long, but approval to keep service continuity over the forthcoming months. So under item 2.2, to noting tenders to be awarded and seeking approval, and then 2.2 are 7 contracts to be extended. Item 2.3, members, are tenders to be issued. So there are 10 of those over the forthcoming period. And at item 2.4, members, is to seek permission for a delegated authority for the Chief Executive to award tenders in the periods April, May to the most economically advantageous tender, and that an update will be presented to the June Policy and Resources Committee of all those tenders approved in that period. In terms of matters for information, members, they're detailed at 3.1. So there are 4 tenders there that have been awarded. And again, members, reminder that all of the information in relation to the tenders is on minute pad for yourselves. So subject to any queries, members, there are a suite of recommendations at section 9.1 of the paper and 9.2. Thank you, Chair.
Thank you very much again, Catherine, for that comprehensive document. We go now to Councillor Thomas O'Reilly via WebEx.
Thank you, Chair. Just if I could ask for some clarification on 2.3 there, Catherine, the residual and bulky waste anticipated cost. Am I reading that right at $1 million?
Yes, that's correct. Councillor Riley.
Do you want to just sort of, anybody like to break that? It just seems an extraordinarily high cost in comparison to anything else we're doing. How is the bulky waste so expensive for us?
Yeah, so sorry, Chair, it's the collection and the processing, so it's based on the tonnages of waste multiplied by an estimated of those tonnages cost for a 12-month period.
I'm still back to it, Chair, is to we must be taking an awful, what are we taking that if you look at any of the other ones there, Chair, we're talking in the tens of thousands. Why are we collecting that much in three? Is it 3 terms that or 3 different bulky uplifts, or is it 2? And do we take that much in that it's costing us $1 million? And do we need to look at this as to you know, what it's costing?
Sorry, Councillor, just for clarity, it's not just bulky waste, it's residual waste and bulky waste.
So that's all our residual?
Yes, it's both.
Yes, yeah.
Okay,
no, that's grand, Chair. In that case, thanks, Catherine. Just my mistake there, reading it wrong. In that case, Chair, I'm happy to propose as outlined.
Okay, you're proposing all the recommendations. Thanks, Councillor O'Reilly, for that.
Thank you.
Back to WebEx again, Councillor Anne-Marie Donnelly.
Thank you, Chair. I'm happy to second the recommendations. Okay,
proposed by Councillor O'Reilly, seconded by Councillor Anne-Marie Donnelly, that the recommendations are approved. All agreed. Okay. Thank you for that, Catherine. Now we're on to agenda item 5.5, and it's to consider the report on staff matters, and it's paper E. And there'll be pieces of from the other correspondence file in this as well, and that'll be taken by Thelma, head of human resources. Thelma.
Thank you, Chair. And as Catherine says, there's quite a lot of items in some of these reports, conscious that we need to get everything we can through before the end of the committee reporting period. So the first item is for decision and the remaining items are for information, Chair. So the decision item is the Local Government Staff Commission continuing operations. It's our annual subscription there, and we have the details of that now, and it's just under £20,000, and that represents a decrease from the previous year's operations. Just for your information, Chair, you know, the Local Government Staff Commission does continue to operate, and we continue to avail of support and services through the Staff Commission, such as on senior recruitment. They're working on a number of equality succession planning projects, and they're also supporting work at a regional level in relation to regional negotiating mechanisms for on behalf of all councils. And again, they can provide support on other matters which require an external third party independence. So that item is for approval, Chair, and the remaining items then for information. I'll quickly take you through those. The first item is in relation to the NILGUS pension scheme, and that's the annual review of employees' contribution rates, and those are set out in paragraphs 3.1.1, and then the employer's contribution rate continues as reported previously at 19%. And a further item in relation to the NILGUS pension scheme is the correspondence item that's in the later on in your documents, which is in relation to a consultation. It's a letter dated the 10th of March from the Department for Communities, a consultation on the proposal to change the date of the annual revaluation in the local government pension scheme, and it's a technical matter, and we therefore wouldn't be proposing respond to that consultation, so it's included in the other correspondence for noting. And finally, just on pensions, we have another item of correspondence, and that is through the Northern Ireland Civil Service Pension Scheme. It's an item of correspondence in other correspondence dated just till I get the right date on it. It's from the Department of Finance, and that's dated the 14th of March, and that is really the revised salary bands for the Northern Ireland Civil Service Pension Scheme. So it's similar to your report earlier in relation to the NILGUS pension scheme, and that's an annual revision that we would have through, and that's, so again, that's for noting. At this time, we have about just over 20 employees who are members of that pension scheme. Item 3.2, Chairman, is just to give you an update on the national negotiations in relation to local government pay. So that's the update for 2023-2024, and we have received information that at a national level an offer has been made by the employer's side, and the details of that offer are provided to you there. It's basically an annual increase of £1,925 per annum for all spinal column points up to point 43 on the NJC pay spine. I noted earlier that Annex A was missing from your paper, so I only circulated that this afternoon to members, but that indicates to you the equivalent percentage rise that £1,925 would impact on the various points. So they range from 9.42% at the lower end of the scale to 3.88% at the higher end of the scale. So it's noted in that this would mean that the minimum rate of pay from the 1st of April 2023 would be £11.59 per hour. Now, for our own employees, that would actually be £11.79, because we don't actually, from the 1st of April 2023, we won't be paying anybody on the minimum 2 points of the scale anyway, because of the local pay agreement or pay offer that we're implementing. So it's reported for information, Chairman, at this time. It is subject to trade union ballots, and we don't expect to know the outcome of those ballots until June or July, because of the processes that the trade unions have to go through in relation to consulting with their members. So, Chairman, the recommendations from the report are that you approve the Local Government Staff Commission annual operational costs. You note the NILGUS employees' contribution rate bands, the employers' contribution rates, and the revised limit for additional pension contributions from the 1st of April 2023, and the item of correspondence related to the consultation on the changes to the NILGUS revaluation of the NILGUS pension scheme, and also the item of correspondence from the Civil Service pension scheme in relation to the revised salary bands for the Civil Service pension scheme. We're noting, as well as the update on the local government pay negotiations 2023.
Okay, thank you very much, Thelma. Right about there. Okay, just Chief Executive's advising me here that Councillor Donald Coffey has declared an interest. So that's duly noted, Councillor Coffey. Okay, we're into the chamber here now with Councillor Alex Baird.
Thank you, Chair. Thanks for the report, Thelma. My query is 2.1, the Local Government Staff Commission. I understood, it's a body I know very little about, so that's probably why I'm asking a question as to what they do and what we get back for that £19,000 that we're paying them. I understand that this body was to be decommissioned for a commission some time ago, but it hasn't happened. Yet we are faced with the annual payments. Now, I know 19,000 in the overall scheme of things, not a lot, but if you look after the thousands, the hundreds of thousands will look after themselves, to misquote. So can someone tell me what we get from Staff Commission for the 19,000?
Thanks, Councillor Baird. Thelma?
Thank you, Chairman. And yes, there is a proposal that the Local Government Staff Commission will be dissolved. Legislation has not been implemented yet to dissolve the commission. But at this time, I mean, they have run down their services fairly significantly over the last number of years. And I suppose you will note that the amount that we pay every year actually tends to be reduced. But the types of service that we get is that they will support us if we have any senior recruitment. So that's at director or chief executive level. They will provide an external support for that. They are working at the moment in relation to setting up and establishing a regional negotiating machinery with the recognised trade unions regionally. They also provide us with access to the code of procedures for recruitment and selection, and they're reviewing that actually currently at the moment. They provide support for a number of equality initiatives, as well as they're working as well on a succession planning project for the local government sector. And they also provide support in relation to if we need an independent support or an independence. And there's a matter in confidential staff matters later on this evening where you'll note that we are actually engaging with the Local Government Staff Commission on that as well.
Well, Thelma, you've convinced me that we're getting value for money. Otherwise, I'm sure you wouldn't have put it in the first place. I just wanted clarification. Apologies for the fastball, if that's what it was. In that context, then I'm content to approve 9.1 and also to note 1 and 2. Thank you, Chair.
You're proposing the recommendations. Okay,
Yes.
Councillor Baird.
Thank you.
Thank you. Now over to WebEx, and we have Councillor Emmett McAleer.
Yes, Chair. It may be as the mandate draws to a close, myself and Councillor Baird are finally on the same wavelength, but I was going to raise exactly the same question there, and I suppose my Google search must have turned up something similar to his. I believe he's right when he says that in 2017 this group was supposed to have been wound up, but unfortunately or otherwise, I suppose it wasn't due to a lack of a sitting stormont. But I do have a couple of questions in relation to that in terms of, I suppose, the recommendations throughout, and mindful of the note at 3.2 of the potential increase of 3.88%, which obviously is far below the rate of inflation and isn't going to benefit people in the current cost of living crisis. And mindful too, I suppose, that we're awaiting a response from the relevant trade unions in relation to this. I'm going to just dissent from this particular item, Chair. Thank you.
Okay, you're dissenting. Okay, thank you, Councillor McAleer. Okay, it's been proposed by Councillor Baird. Can we have a seconder for the recommendations, please? Councillor Paul Robinson. Are we all agreed? Okay, thank you very much, Thelma. Okay, we're now on to item 6, and it's the Chief Executive Directorate reports. 6.1 to consider the report on governance arrangements, and it's paper F. You should have all received that in your packs. Alison.
Yes, Chair, thank you very much. And I appreciate there's quite a bit of information here, members. So I'm just going to work through, summarise the key issues, and also highlight the matters really that we do require or would request a decision this evening. I suppose just to say at the outset, the local government election, as you know, was on the 18th of May. So the decision-making body in relation to most of these matters will actually be the new council. But really, to allow the smooth running of the first annual meeting of the new council, it's necessary to have as much in place as possible to allow for those preparations to be made. And we're working on the basis that the annual meeting will be held on the 5th of June. So in terms then of the report itself, Chair, we need your views and decisions in relation to standing committees, subcommittees, the compositions, details around the positions of responsibilities, the method as to how those positions are filled, what are known as SRAs or Special Responsibility Allowances, and then the nominations to committees, external bodies, internal working groups, as well as the audit panel and scheduling and timing. So in terms of the committees and subcommittees, as you know, we currently have 5 committees, and I think there's probably a growing recognition that the work of the Brexit committee has largely completed, and as such we've moved to quarterly meetings. we'd be recommending that we no longer have a Brexit committee in the new mandate and work on the basis of 4 standing committees. That would be Environmental Services, Regeneration and Community, Policy and Resources and Planning. We also have 2 subcommittees, both of which were established during this mandate. The Health and Social Care Advisory Group was essentially redesignated as a subcommittee, and as you know, the terms of reference currently require the trust to be in attendance. It would certainly be good practice as part of the review that we would engage with the trust and indeed other stakeholders to gain their views as to what the most effective mechanism for future engagements would be. So with your approval, we'd intend to do that and report back to the new council. We've obviously had the Rural Affairs Committee, which was established slightly more than halfway through. And again, if we're seeking your views as to whether that should be retained, and if so, we would certainly seek to include other areas of relevant work within the terms of reference. And I know that it was maybe a bit of frustration at times for the Rural Affairs Subcommittee that some matters that they may wish to discuss were in fact the responsibility of others. Section 2.2 then, Chair, deals with committees, subcommittee membership. With the exception of the Planning Committee, we've worked on the basis of full member committees. So again, we need your views as to whether that should continue or whether we should work on a reduced membership to committees. And if that is the case, we would also require the proposed number for such committee membership. We are recommending that we would retain the Planning Committee at 13 members. There would then be a knock-on effect if we were to continue with the subcommittees, if we were to just reflect the subcommittee membership relevant to the wider committee structure. The recommended approach to nominations for committees and indeed subcommittees is what's known as the quota greatest remainder formula. That's the default mechanism which is set out in the legislation, and hence it's why it's important for the annual meeting that we know the number of positions that are to be filled. In terms of positions of responsibility, I suppose just to summarise in section 232 of the report, Chair, the positions that we currently have. These really, with the exception of the PCSP, where we had received advice previously from the Department of Justice, these really are matters for the committee itself, but it would certainly be the norm that you would attach a position of responsibility to the chair, vice chair of the council, as well as the chairs of the standing committees. And then we also had the partnership panel for Northern Ireland for a 4-year term, 1 member, PCSP 10 members for a 4-year term. And again, while we haven't had it formally confirmed, our expectation is that that should be a similar arrangement for the new mandate. The Northern Ireland Housing Council and the Reserve Forces and Cadets Association, both of which would be 1 member for 4-year term. We would be recommending that we would use the default mechanism for positions, which would be Dehont. There are others, notably St Lag, but if you proceed away from Dehont, we would require a qualified majority vote to proceed on that basis. Nominations to external bodies and internal working groups is really done on a pool system. Pool 1 are positions to be filled by agreement, which is where we would certainly hope to be on most occasions. And in the absence of agreement, positions would be filled using Dehont, but this would be separate from the process applied to the positions of responsibility. In terms of the internal working groups, Chair, we have quite a number of those now, and the intention is that we would review each of them. In some cases, the work has been superseded. We may also have some gaps as well, and that we would bring a full list to the new council, and those groups that would be necessary for decision making and policy formation would be the continuing groups. In terms of the audit panel, we would be recommending that we would retain the current composition of the audit panel. So that would be 5 elected members and 2 non-elected independent members. It would also be proposed that we would continue with the chairperson of the audit committee being for the full 4-year term, and that would be the nomination from the largest party. And we've set out in the report what you would do in the event of there being 2 parties with the same number of seats. And in line with good governance, it would generally be held that if you're a member of the audit panel, you should not hold any other position of responsibility within the council. In terms of scheduling and timing of council and committee meetings, Chair, we would be proposing to essentially replicate the structure we have at the moment, and we would be working on the basis of 7 p.m. commencement for council and committee meetings and 2 p.m. commencement for the planning committee. In terms of the actual operation of those meetings, one of the outworkings of COVID has been the hybrid basis of meetings. You'll recall that this is on a rolling basis. The legislation is currently due to expire on the 24th of March. Expected it'll roll over again. Now, the expectation is when the Assembly is up and running that this would be made permanent. Certainly have obviously sought members' views generally in paragraph 272. And I think in recognising the benefit of hybrid working, there's also a benefit in members knowing each other and working together. And the suggested approach that we would work, that council meetings would be held fully in person, committee meetings on a hybrid basis, and all other meetings, as is currently the case, would be fully virtual. There may be occasions when in-person workshops would be required, so we build in that flexibility. In terms of standing orders, good practice would be that we would review those at the end of a term, and we will do that. And if hybrid and virtual meetings are going to continue, we would update the standing orders accordingly because we'd have been outside of the emergency period. Special responsibility allowances, and again, we're proposing a change here, Chair. So we've set out the original arrangements in paragraph 292, and what we are proposing to do in 293 sets out the particular constraints around SRAs. So these are very much bound by legislation, both within the budget and the numbers of members who can actually receive an SRA. But given the very significant workload that has fallen and will continue to fall to the members of the Planning Committee, we're proposing that membership of the Planning Committee will attract an SRA. So you would have the chairs of the standing committees, we would have 4, the chair of the audit panel, the members of the Planning Committee and the Partnership Panel for Northern Ireland, based on a pro rata attendance in the absence of a regular schedule of meetings. So that would leave us with 18 SRAs. We are allowed 20, so it gives us a little bit of flexibility for change in the incoming year. There will be a requirement, obviously, for nominating officer roles, and it may be that the new council would wish to formalise the structure for group leaders and engagement. I think all other councils have that, but no SRA would be paid to group leaders. Then just paragraph 210, Chair, is the formal request that we close Omagh Leisure Complex from 12 noon on the 18th of May to facilitate the local government election count, and it is expected to reopen as normal on Sunday the 21st of May. The pre-election period of sensitivity commences on the Thursday the 6th of April, and we have appended to the report the guidance that NILGA have provided and which we would be intending to implement. So that, in summary then, Chair, recommendations are all detailed in paragraphs 9 or pages 9 and 10 of the report, but really the views are sought on the committees, the membership of the committees, clarification or confirmation on the method for nominations to committees, confirmation around the positions of responsibility, and confirmation on the special responsibility allowances, and also a number of details there specifically to the audit panel, which really is reflecting the current position, the only difference being that the only SRA payable in the new mandate, if members agree with the paper, will be to the chair as opposed to the chair and members, which is the current position. So happy to take any queries, Chair. Thank you.
Thank you very much, Chief Executive, for a very, very comprehensive report indeed. And if my count and my maths is right, there's 18 parts to the recommendation. So we're going to queries or comments. We're going now, first of all, to WebEx, and we have Councillor Emma McAleer via WebEx.
Thank you, Chair, and thanks to the Chief Executive for that rundown. Yeah, obviously there's a lot in this, so I'll try and skip through it as quickly as possible in terms of the recommendations. Happy enough to note recommendation 1. In relation to point 2, and I suppose it relates to point 5 as well, I'm happy that we proceed on the basis of the existing standing committees. I would be inclined that we actually, given, I suppose, the threat that we're currently facing to our health and particularly to the operations at the SWA, that we actually include or upgrade the Health Committee to a full standing committee. So I would be making that as a proposal. Recommendation 3, I'm happy enough that we continue with the Planning Committee as set. In relation to the number of members involved in the committees at point 4, I would recommend that we continue with full member committees. I think it's the only fair, open, transparent and accountable way to do business, and it has worked effectively throughout the mandate of this current council and has done in previous years. Item 6, I would be happy enough that we do retain the Rural Affairs Subcommittee. As someone who sits on that particular committee, I think it is important and has done some very important and some very interesting work, particularly with our data scientist. I would be open to hearing or listening to proposed improvements or additional workloads that could be taken on by that. I think it should be an open group too. I'm happy enough if we do continue with the setup as present, but I do think we shouldn't be excluding anybody given the rurality of this particular area. In terms of point 7, then the nominations to committees, I think again that should be something that we could agree, and I do think it should be full membership, so hopefully it shouldn't be required to receive much agreement. Point 8, the positions of responsibility. I suppose I'm happy to see that it is being refined, given in mind the financial burden that it is placing on this council, and I do appreciate the training and the effort that's put into the planning committee. But I would be proposing that the members on the PCSP should be removed from that particular list. I don't think it's certainly not beneficial to my own DA. Others will have their own views on that, but I do think that should be removed. That would save expenses on an additional 10 elected members. Skipping on, I suppose there are a couple for noting there, happy enough to do so. In terms of number 11, the audit panel, happy enough with that. I would do have a query in relation to that. It talks about its member of each of the 5 largest political parties represented on the council. Now, there are 4 parties that have a majority. There's then the Alliance Party and the Cross Community Labour Alliance, which both are political parties but only have 1 member. So I'm wondering how you determine
there, Councillor.
Party is there. And just finally there, Chair, I think the rest are mainly for noting. I'm happy enough with that. I would be proposing just on point 15 that we actually continue, even with our council meetings, to have the option of hybrid. I think there's no problem in promoting it to be fully person, but obviously dates and all the responsibilities might refuse or not allow people to.
Yep, a wee bit of latitude there, Councillor.
Happy enough to note the rest of it, Chair, but just that would be the final proposal, and thank you.
Thank you. Okay, some clarification from our Chief Executive.
Yes, Chair, just maybe on a couple of matters, and also in relation to a couple of the proposals. Just in terms of recommendation 7, which is about the nominations to committees and subcommittees if applicable, it's just to say that it's a requirement that the council has to confirm the method by which nominations to committees are dealt with, which is the quota greatest remainder. So even if you proceed with full member committees for everything, you still need to confirm that that is the basis on which you nominate across. So we have a requirement to have that. In terms, I think maybe just a little bit of confusion, Chair, just on item 8 there. The positions of responsibility are not the same as the special responsibility allowances. So the positions of responsibility in the case of the PCSP members are designated as a requirement by the Department of Justice to the Council. So certainly if that is mandated, that will be something the Council will have to adhere to. Of course, it is then up to members individually if they are allocated those positions to accept or decline. In terms of the audit panel, yes, just number 11, just to clarify on that. So the current composition, we actually started with 6, we had 7 members. So we had the 2 single member parties and independent, who was Councillor Swift, as well as the 4 larger parties. Councillor O'Coffey then withdrew. due to work commitments, and the audit panel, subsequently the council, agreed that it was appropriate for the composition to remain at 6 members. So what we have done in this recommendation is recognising that there are likely to be more than, as we have now, more than 4 political parties, that you had 5 largest and 1 independent member. And detailed in the report, we set out how those positions would be agreed. In terms of hybrid, that's fine, Chair. We can certainly note that. I think the point that was being made was to allow for the flexibility. I suppose the other thing that I would just note more generally is that, particularly for a new mandate, I think it's important that members get to know each other. And if we think of the last 3+ years now, there has been less opportunities for that to happen, but obviously it's entirely for members' discretion. In terms of the Rural Affairs Subcommittee, we wouldn't, the areas of work, the things that had been potentially strayed into by Rural Affairs would have been largely around broadband, some of the agriculture related matters, also some of the direct community support areas. So it would really just be to enhance the work programme. And finally, the proposal on health. We couldn't proceed for health as a standing committee, as it's not a statutory or with council has no competence in health. So it would be inappropriate for us to have a committee on the subject. You could obviously continue with a subcommittee basis, but that would be subject to our relevant stakeholders presumably agreeing. So that those are my comments just in relation to those, Chair.
Thank you very much, Chief Executive. And now we go to the chamber with Councillor Victor Warrington.
Thank you, Chair. I'll start off with the Health Committee. I think the Health Committee is obviously, I would be very much in favour of retaining that. The only thing I will say that when we went to the subcommittee status back some time ago, I feel that the trust has been not as open and transparent with that committee as the war, but certainly I think it's important that we retain it. As for the hybrid, I think hybrid is good, but I think it needs to be either an all in or all out. And certainly the subcommittees on, certainly I would agree with having the council meeting, full council meeting within the chamber, everybody in attendance. I suppose the argument for the larger committees was to get the business done more succinctly. Where this was initially worked in the first mandate, it certainly had become more difficult lately, as we all want our council to run efficiently. And I think that smaller committees will help to achieve that. We are not out to silence any individual. The agendas for all the meetings are published days prior to the meeting, so any queries can be referred to the relevant officer to assist. Also, all decisions taken by the smaller committees will have to be ratified by the full council. In saying all that, my proposal would be that we reduce the committees, the R&C, P&R and ES committees to a number of 15. It'll make it more manageable and make meetings more efficient, and that is certainly my proposal going forward, Chair. I think that's all I have to say at the moment. Thank you.
Thank you very much, Councillor Warrington. The chamber again, we have Councillor Eamon Keenan.
Thank you, Chair. Well, you had my mic on earlier on, but it seemed to be turned off. So press it again there, but
sorry,
I did have my microphone on just while Alison was speaking about the report.
Right.
So I was
sure you had both me put you off.
I was in before Victor there, but I pressed it again. I'm in there.
Called.
Hopefully,
carry on now.
Back on the agenda, but yeah, no, I disagree with Victor. I'd like to second Councillor McAleer's proposal that we have full membership in the committee. I think it's important that everyone's voice is heard and everyone in the community is represented. So I'd like to second the proposal by Councillor McAleer. Thank you.
Okay, thanks for that. Now we go on to the chamber again, and we have Councillor Alex Baird.
Thank you very much, Chair. Interesting. In many ways, it might be strange me speaking of this, the fact that I certainly will be one councillor who will not be in the new dispensation, the fact that I'm not running again. But this is something I really feel strongly about. That's the issue of the size of committees. Now, it's been alleged that the system that if you work with full committees is fair, open and transparent. Well, I think that can be countered by the fact the question is it an effective and efficient way of working? Normal administrative and business practice has it that committees are just that, committees of a board, this being the board that we're in. And the normal practice and procedure is that it's reduced numbers from whatever size the board is. Now, in local government in Northern Ireland, the 11 councils, all 10 other councils have reduced committee members. So it's working everywhere else. It has been alleged that when this matter was raised before, that it was there to exclude certain members. Well, the fact that this is coming up now, I think it's timely. In the context, I can say with certainty that I won't be in the next dispensation. There's others around here will, and there may be some others who won't. So setting this rule now is getting off to the right point, that there can be no allegation of a vested interest of some people trying to be excluded. As I say, it's useful business practice. It's normal business practice. We're the only council that doesn't go down that route, and I think it's the only way forward. So, and for anybody to try and make political capital about exclusion, they need to bear those points in mind. Thank you very much, and I will certainly second Victor's proposals. Thank you.
Thank you, Councillor Baird. Okay, on to WebEx now, and we have Councillor Seamus Green via WebEx.
Thank you, Chair. Yeah, it's an interesting debate on this pros and cons on each side about full committees and smaller committees. I'm one of the councillors that has, like yourself, seen smaller committees and full committees, and personally, I prefer the full committees for the reason that, in my opinion, if we go to the smaller committees, we will never get the full council meeting finished, because people that weren't at the committees will ask that many questions on every single subject. It will go on. There'll be 2 or 3 council meetings will have to take place to get it done, and we will completely defeat the object of what we're trying to do. So personally, having seen both sides of it, I prefer the full council meeting. I also agree that the full council should be in person. In fact, I go as far as to say all of them should be in person, but I realise it doesn't suit some people and that, but definitely the full council meeting should be in person. Up until COVID, everyone was fit to turn up to all the committee meetings, so there was no problem. And so to be able to turn up for one full council meeting in the month, I don't think that's that big of an ask. I would agree with the Brexit committee. It's probably has run its course. I would maybe suggest that there would be some part of one of the other committees, maybe where that could be raised as an agenda item in case it raises its head and affects our council area. So I would suggest that. The other thing, the smaller on the audit committee, I believe you said that it was 6 members, and is it right that we're talking about staying at 6 members? I probably agree with that as well. So I agree with what's been said. I would definitely retain the Rural Affairs subcommittee. I would definitely be retaining an Agriculture Liaison Group. So apart from that, that's my opinion, and I know others has different views, but that's my opinion, and that's my logic to having that opinion.
Thank you very much, Councillor Green. And now we'll go to back into the chamber, and we have Councillor Tommy Maguire.
Gurmagana Carly, thank you, Chair. Just maybe a couple of questions. First of all, Victor has proposed a number for the reduced committees. First question would be, is there within the DeHunt system a desired number, or is that purely an option that we would have, or is there a formula already in place? That's just the first question. And then again, on this recommendation in front of us tonight, again, obviously, post-election, this could all be changed around at the AGM, given the proportionality of those elected, which is, I think, was the intention of the DeHunt system. So whereas we understand the reasons for the chief executive desiring guidance on the governance, just to calm people down, the fact is proportionality will come into play post-election, and if the people have spoken and the numbers are there, it can be changed and it can be redecided on. But my personal opinion, I think I've stated it already, is that I think, having experienced the reduced committees in the former council, I think in practice they are easier to get the committees work done. It may not be, as Councillor Green has indicated, it may not be as simple to get it through the monthly meeting. I can see, and I do understand that that was the intention of going to full committees, was to reduce a logjam at the full monthly meeting, but it ended up then we've had every committee nearly as a logjam in this mandate, which hasn't been very satisfactory. It has used up an awful lot of councillors' time. Some of it you would wonder how worthwhile it was, but a lot of hours have been put in over the last mandate. It doesn't suit councillors that have other employment, and I'm sure there'll be a lot of nodding heads around the chamber with that, and I understand that. So I'd be happy enough to support these recommendations as they are. Just a question on what is a desirable committee member size, and again, as I say, this can all be predetermined or redetermined post-election, and proportionality is the key word for the DeHunt system. So it's the default system for every other council. I'm quite happy to run with it in this council chamber.
Thank you very much, Councillor Maguire, and I'll bring the Chief Executive in to ask you or answer a few of your queries.
No, well, just specifically, Chair, the only committee that is specified in legislation around a number is the Planning Committee. So it's entirely at the Council's discretion, the numbers it would set for other committees.
Sorry, Chair, just on that then, is the Chief Executive aware of the accepted sizes among the majority of the rest of the councils? Please, Chair.
Sorry. Yes, Chair. We've, I suppose, set out on average between 13 and 17 members, most settling in and around 15 or 16.
Okay, thank you. Councillor Wright Crawford, the chamber. No.
Just to come back on with respect to Councillor Green about saying that meetings wouldn't be finished on time on a full committee. It works on the other 10 councillors, so I can't see why it can't work here. Just my comment, thank you.
Okay, thanks for your comment. Councillor Maguire, you want to link it?
Just to make a proposal on the number. Sorry, Chair, for their submission, but just on consideration of the size of the committees, could I propose that that would be decided at the AGM post-election? No. Sorry, go ahead, Chair, Chief Executive.
No, sorry, Chair. The issue here is if you go to a reduced member committee basis, we will need to be able to present at the annual meeting the positions that each party and individuals are assigned. So you will need that in advance, and the calculations are quite detailed. Now, we can't do the calculations until after the vote. Now, certainly what could be done, if, for example, there was a desire to move to reduce member committees, it could be in the you could opt for, say, 15 or 16 or 15 or 17, and we could work the calculations on that basis. But we wouldn't be able to do the calculations on the night. And the reason for that is you need to know the number of positions to be assigned against the votes obtained before any committee can be populated or the papers for the annual meeting prepared.
Okay, thanks for that, Chief Executive. Okay, in the meantime, we'll go on to the WebEx. First up, we have Councillor Donald O'Coffey by WebEx.
Yeah, thanks, Chair. I only want to really speak on 4 of these issues, and just quickly. Rural affairs, I think, well, obviously, I'm offering my opinion. Obviously, there's no guarantee any more than anyone else that I will be re-elected. I certainly don't, I don't take anything for granted in that regard. So I still think it's important, though, that we have a system that does not disadvantage independents and single party representatives. And it has to be said that for all its merits, the Hunt system really does discriminate against those who are It's simply the way it works. There is no worse system in a way if you're a single party representative or an independent, because of the way it's calculated. You always end up being the last people chosen, because simply cannot be any other way. It is designed really to ascribe seats to large parties and between them on a basis that's fair between them, and that it certainly does do that job. But the problem is that it doesn't really work too well in regard to single member representatives. The first thing I'd say around the health subcommittee, I think it should certainly continue. We're a council which has literally called for the entire board of the local health trust to resign, we've major crisis in our midst. It's unfortunately cannot go to a full committee. I lost my seat in the process of proposing that this become a subcommittee, primarily because I believe it's vital that its considerations and deliberations are in the public sphere. I do accept Councillor Warrington's statement that that the trust are not being as open. Now it is a public meeting, but even recent events show how, I think it was Councillor Coyle had to challenge them on the way in which certain things were put behind closed doors. And it's vital that this is in the open, openness to have confidence in the community. So I think that has to remain. I would strongly be of that belief. Rural affairs, I'm not on it. I still think it's important we have that. It's clear there's a need for rural issues to be considered, and this council should certainly do that. In regard to reducing subcommittees, I've raised my concerns around the Hunt mechanism. I do think it does effectively exclude single member parties and independents. The full committees are inclusive, but the main point I was going to make has been made by Councillor Green, which is that it simply would cause everything to go into the full committee. And moreover, we as a council actually removed matters arising from full council meetings precisely because this is what the problem was. And they are now devolved, if we wish, down to the committees to consider the matters arising within the committees again, which makes sense. And it also distributes the weight. And really, it has to be said that we are getting through all the work. There's hardly a meeting goes by that we don't get through these days. It can be tough. There's a lot of stuff to be considered. The job of a councillor is difficult, it has to be said, but we are doing the business, and I don't think that there's any real grounds to move to exclude. And finally, I think we should allow for flexibility, and that would mean there are potential benefits from allowing people to Zoom into meetings. They may not make ordinary meetings. I do take the point that it's nice to have everyone there, and I agree. But it reduces our carbon footprint, and I think it isn't inclusive. So I would be supportive of retaining flexibility. Thank you, Chair.
Okay, you were given a wee bit of latitude again there, Councillor O'Coffey. So I know it's a big subject, this, and 18 parts to that. So there's a wee bit of latitude has been given this evening on that particular document. Moving on again, we have Councillor Mark Buchanan via WebEx. Councillor Buchanan.
Thank you, Chair. Just a few points on the report, and thanks to Alison. There's a lot of detail in it. I suppose from our perspective, we'd be happy to maybe support the smaller committees. Appreciate what the independent members are saying as well, but I do believe that it says in the report about the other councils that, and it seems to work well from other members that I've spoken to, but we would support the smaller committees. We've had a lot of I know members are saying there about getting the business done, but we have had a lot of long meetings, a lot of late nights, and hard work put in. And I believe maybe smaller committees could help alleviate that. Just on the planning committee members and the SLA for those members, we'd be happy to support that with the extra workload they'll have. and hybrid meetings, happy enough to keep that flexible as well. And just maybe, I know it can be decided with the new mandate, but even the timings of meetings, and I myself employed full time, but I think maybe if there'd be, even with smaller committees, maybe there'd be the possibility of changing the meetings maybe to a bit earlier in the day, that it could suit them, the less number of members. But that would just be my view on the report. Thank you, Chair.
Okay, thanks, Councillor Buchanan.
Sorry, thank you.
Councillor Mary Gardy via WebEx.
Thank you, Chair, and I'll be brief on it, but just to add that in our group, and there would be mixed feelings at times. I know from the first mandate that I'd been in 2014 going forward, the full committees was definitely my preference. In recent times, they've seemed to be a wee bit more arduous, and as I say, often people within own parties, often people within parties would have differing views as to full member committees or not, and that's fair enough. I suppose my point is, Chair, I remember initially as well, meetings were to be at 4 o'clock, councils and committees, I think it was, and it was changed to 7. So this is all going to be decided by the new mandate. So I don't think any of us need to get too excited. But I think on the whole, we as a group have decided that smaller committees are possibly the way forward with the amount of workload that's in councils and in general. Does Councillor McAleer need in? Chair might be having, he indicated something I didn't quite see. He might need IT support. There was emoji or something there come up, but I didn't quite see it. But so I'm just saying, it's I think if it's coming to be, I've noticed now 3 nights a week, 3 to 4 nights of the week, 3 weeks of the month, and it's quite a lot of people say there's people having second jobs and one thing or another. It's certainly something that should be investigated, but ultimately it's a decision for the new mandate, and it's something that I think should be seriously considered. Nobody definitely wants to isolate anyone, that would not be the position. But I do be at home now, and a lot of the times for these meetings, and I'm sure like other councillors, there might be some public interest when there's people here, and some people have got great interest that wouldn't normally log on, and they do have indicated to me that it is the same sort of people who are given possibly their input to the meeting, and it seems to go around in circles a while, and that has been mentioned to me by people that have listened in, and that's fair enough. People are entitled to do that, but I think smaller committees might give other people a chance to explore what they might. Some people I do know have been disillusioned with coming in with some of the items. So I think it's something that a smaller committee could have better participation from the whole council group and then fully. But as I say, it will be a decision for the new mandate, but we by and large would be supported. So in terms of Victor's proposal, we'll support it. Thank you, Chair.
Okay, thanks, Councillor Gardy. And via WebEx again with Councillor Robert Irvine.
Thank you very much, Chair. I just need clarity. Who has proposed what in regard to the recommendations?
Can I just come on there, Councillor Irvine? Chief Executive will come in when of all speakers. We have another speaker after you, and that's Councillor Bale, and then we're going to bring it to conclusion. So the Chief Executive will come in and summarise and see where we get to from there, because there's 18 parts to this recommendation. And a sample by the side of it. So carry on.
Right. Well, my position is I'm actually happy to go with all of the 18, and I will clarify in regard to item 4. Sorry, my proposition would be that the Chief Executive prepares models for 15, 16, and 17 membership of the standing committees that will remain, and that those figures should be brought forward based on the outturn of the election, and then I believe the members remaining in the chair can actually make a decision then. I agree, clarify that the Rural Sub-Affairs Committee should still stay. With regards to its composition, I think options should be brought forward for members at the general meeting to consider. And as far as all of the other proposals, I agree in their. So those are the 2 clarifications on the 18 recommendations. I'm in agreement with all other 16.
Okay, Councillor Irving.
Thank you very much.
Councillor Matthew Bell in the chamber.
Thank you, Chair. Whilst waiting, I think a few others hit the point I want to make. And I suppose I'm in favour of, of smaller committees as well, simply because of one of the facts that has raised in the course of this meeting being that every other council in Northern Ireland operates that way. You know, in the entirety of human history, good practice spreads, invention spread, and it seems that we're last in the list here, and it seems we're being left behind. And whether being economically, environmentally, socially, or politically, in this case, I don't want to see Fermanagh and Omagh District Council left behind. So I think it's time that we fall in line with the rest of the councils across Northern Ireland and now have smaller committees as well. So thank you, Chair.
Thank you. Councillor Bell. Now, Councillor Green, that you've already been on, is there something really specific that you wish to comment on?
Yeah. I would suggest that if there's going to be modelling done on the numbers, that we model also 20 member committees. That's half of the council. And as I say, personally, I would be on for full committees, but at that stage, the new council will make the decision. But if we're modelling, I would also suggest 20 as well as them other figures that was suggested.
Okay. Councillor Diane Armstrong via WebEx.
Thank you, Chair. Just to state that I certainly would support smaller committees in order to get the business done, and I would like to go in and second my colleague Councillor Irvine's proposal there of the recommendations and the 2 that he detailed, particularly looking again models of 15 membership of 15, 16 and 17. Thank you, Chair.
Okay, thank you. Councillor McAleer, you've already been on.
Chair, just very briefly, I appreciate you let Councillor Green back in just to make a very brief point.
Trying to move this on, but go ahead.
Just a very brief point, because it's something that's been raised, I suppose, a couple of times there, that other councils are using a different model. But the fact of the matter is that the same gripes exist within other councils, that independents and smaller parties are excluded from the bulk of the meetings and the decision making, and that's an issue we don't want to see replicated. So it's a backward step, and we don't want to be making it. Thank you, Chair. Okay, I want to bring this to a conclusion, folks, and there's people there coming on again that have already been on. Councillor Riley, you're the last speaker. I'm making a ruling on that.
Thanks, Chair. I'll just be quick. I'm happy to second Seamus's that we should model the 20 as a half council committee. Thanks.
Thanks. Thank you. Okay, could you just lower your hand there, Councillor O'Reilly, please? Thank you. Okay, everyone has had their say. It wanted to have their say, and people were in the second time. It's a very important one, and it's quite a lengthy document. 18 pieces on it, 18 recommendations, or parts of the recommendations. So I'm going to bring the Chief Executive in here now to try and summarise as best we can what has been proposed and commented on. All the best, Alison.
Thank you very much, Chair. Well, Chair, actually, I think there's quite a lot of consensus, first of all. So what I would suggest, maybe if I just summarise where I think we are agreed, and mindful we do have Councillor Irvine's proposal that's been seconded, but just it would probably be useful just those matters where we are clear. So obviously the noting recommendation one is fine. It appears there's agreement that we would proceed with the 4 standing committees as listed. So that's Environmental Services, Regeneration, Community Policy and Resources and Planning, that the membership of the Planning Committee would be set at 13 members. I'll return to recommendation 4. I think, Chair, there's a consensus that the importance of the health care subcommittee, but presumably there's also a recognition that we do need to review the model of it, and particularly the role of key stakeholders. And I don't think recommendation 5 is inconsistent with that. So I think we could recognise the council's desire to retain the structure. Similarly, the Rural Affairs Subcommittee, and we can revisit, as was suggested, the composition at the annual meeting. I think hopefully with the clarification, Chair, and I know maybe I appreciate there's a lot of very technical terminology, but you're required to have a mechanism to nominate 2 committees, even if they're all full member. So we would certainly, I don't think there's anything other than recommendation 7 that can proceed. There was one, Councillor McAleer indicated dissent regarding the positions of responsibility in specific reference to the 10 elected members of the PCSP. Again, that's something, if directed by the Department of Justice, that we have to do. And I would suggest there seems to be broad consensus bar that dissent. The methodology, the Pool A and Pool B, there appears to be agreement on it. There appears to be agreement around the review of the working groups, albeit some views have been expressed around some of those. Just to confirm, the audit panel recommendations as detailed at 11, 12 and 13 are exactly as the current arrangements, and there seems to be agreement with it. There has been some debate around timing, so certainly that could be reviewed in the context of the new council, albeit I think the Planning Committee 2 p.m. is fine. And there has been some dissent around or different views rather, regarding whether or not hybrid extends to the council meetings or proceed fully in person. There appears to be agreement for the special responsibility alliances, the Oma Leisure Complex closure and the pre-election period of sensitivity. So if there was consent on those, Chair, my inclination, or consensus rather on those, my inclination would be, if members were content, that we take Councillor Irvine's proposal, seconded by Councillor Armstrong, for each of those identified, and then we'll move to the areas of dissent.
Okay, thanks for that summary. Chief Executive, I think that's made it slightly simpler to get around this one. Okay, you've heard the Chief Executive, and all the comments and everything have been taken on board, and it's been proposed by Councillor Robert Irvine's proposal, seconded by Councillor Diane Armstrong, and that's the proposal that's going in front of you now.
Chair,
I think somebody had asked for a recorded vote.
This is not the...
Sorry, Chief Executive.
Certainly, Chair. My interpretation was the recorded vote request was on matters of dissent. I think the summary that I've presented, I hope, is reflective of the matters of agreement. So this would be just to see if we've agreement, and we'll return then to the composition, specifically of the committees and the different proposals that have been set out within that, and the modelling for those as well.
Okay. So this is the proposals made by Councillor Robert Irvine, seconded by Councillor Diane Armstrong, as outlined by Chief Executive, where there's general consensus. So, Councillor Riley, you have a query?
Just to add in the 20, Chair, if Robert would be agreement as opposed to taking that separately.
Sorry, we're not, sorry if I'm coming on you there. We're not dealing with that at this minute.
Okay.
Later on, okay? So it's just Councillor Irvine's proposal, seconded by Councillor Armstrong, and there was a general consensus on a lot of those things. Can we have we agreement on that? Great. Not seeing any dissent at this stage. Okay, thank you.
So then, Chair, the first, if you like,
Councillor Irvine wants to come in.
Will I just summarise maybe?
Summarise,
clarify.
please.
So the first proposal in terms of the composition of the committees that we have received is the first proposal that was seconded is Councillor McAleer, seconded by Councillor Keenan, that we propose, proceed with full member committees. We then had a proposal from Councillor Warrington, seconded by Councillor Baird, that we would proceed on the basis of 15 member committees. We then had the proposal incorporated within the wider from Councillor Irvine that we would we'd proceed on the basis of reduced size committees, model 15, 16 and 17. I don't know whether Councillor Irvine would wish to include 20 within that, which was Councillor Green's proposal, which was seconded by Councillor O'Reilly. And but the first proposal that we would take, Chair, on the composition would be Councillor McAleer, seconded by Councillor Keenan. Recorded votes been requested for full member committees, so I would suggest that's if Councillor Irvine may just wish to clarify on his proposal, if he would accommodate Councillor Green's suggestion.
Are you happy enough?
I'm happy enough actually to include 20 in my proposal for modelling. So that my proposal would be 15, 16, 17 and 20. If Councillor Armstrong could come back in and say that she agrees to that, then we can move forward.
Okay, Councillor Armstrong, yep, you're getting your hand up there.
Yes, Chair, I support that. Thank you. I agree with that.
Councillor Warrington, do you wish to withdraw? Okay. Summarise now, and a recorded vote has been requested by Councillor McAleer, and I've granted that. Chief Executive.
No, just to summarise then, Chair, so we've two proposals. The first that will be taken is, and we'll obviously see the results of it, on the proposal of Councillor McAleer, seconded by Councillor Keenan, that the Council proceeds, or recommend to the Council to proceed on the basis of full member committees for its 3 standing committees. That's with the exception, obviously, of planning, which will be 13.
Very quickly, Councillor Bell.
Just really quick point of clarification. The modelling, will that be based on the current council, or will that be based on after the election results?
No, it has to be based on the new mandate, so it'll be after the election before that can be done.
Okay. Okay, we're going to the vote, and it's a recorded vote, and that's again Councillor McAleer's proposal. And Adam's setting the votes up there now. Okay, those in WebEx, I think you're good to go. We're waiting on the chamber. Okay, go to the chamber. Who seconds that?
Councillor Keenan.
Chief Executive.
Okay, Chair, thank you. There were 6 votes for and 22 votes against, so the proposal falls. So we've moved now, Chair, to the second vote. So that was on the proposal of Councillor Irvine, seconded by Councillor Armstrong, that the Council proceeds on the basis of reduced member committees and that we model 15, 16, 17 and 20 member committees for consideration at the annual meeting.
Is this recorded again? And this wasn't requested to be recorded, so.
Sorry, Chair, this would be a contentious one. I would contend, and I did request anyone where there would be dissent. I would definitely be voting against this as a matter to exclude the smaller.
I'm advised we took it on the first vote, so it wasn't requested at this stage. So the vote has already been set up.
Chair, my request was for where there was dissent.
Chief Executive, clarify.
No, sorry, Chair, you can't do a sort of a rolling request. You request vote by vote if a recorded vote is required, and it has to be called before the vote is called, Chair.
That's another way to exclude us, I suppose.
Sorry, Chairman, I don't.
Sorry, Adam. We're still in the old vote here in the chamber. Yeah. Okay, back onto the vote now.
Sorry, Chairman, I don't recall the WebEx here.
The poll won't allow us to vote on
Chair,
WebEx.
Chair, the poll is on WebEx is actually saying that the poll has ended. So
that was poll 1. You need to get out of that and
No,
start your
no,
vote
it's
again.
poll
There's
two.
vote 2 on it.
This is
And it
vote
won't
2.
allow us to vote.
Says
Yeah,
vote two.
vote 2's vote ended as well.
Okay, we'll get Adam to check that out.
Sorry, just to clarify, mine is saying that you cannot create a poll, so it thinks I'm trying to create a poll here.
Okay, just clarification on the issue. Poll 2 will now be run again by a WebEx, on WebEx only.
We call a recorded vote.
No, it's already been decided, that one. Thank you. I have voted on. Okay, there's the. Okay. Okay, Chief Executive will clarify the position regarding the vote.
Okay, Chair, there were 23 votes for and 5 votes against, so the proposal is carried.
Okay, thank you. One further item.
No, I think, Chair, just the only other item that there was some differing views expressed on was whether or not we proceed with the council meeting as a fully in-person meeting, or that we would proceed on a hybrid basis. And so Councillor Irvine, seconded by Councillor Armstrong, proposed that we proceed on the basis of fully in-person for council and virtual hybrid for committees and virtual for all other meetings. So that would be the third area of for voting, or where dissent was expressed.
Okay, we'll be going to the vote for this one, and this is vote 3. Okay, Adam, you set her up there, please. Have to clear us here in the chamber first.
Sorry, my broadband went down there for a second. I didn't hear that clarification, Chair, if you don't mind getting the Chief Executive to repeat it.
Yeah, I'll ask the Chief Executive for your benefit, Councillor.
Yeah, sorry, the next vote is just in terms of the format of the meeting. So on the proposal of Councillor Irvine, seconded by Councillor Armstrong, it would be that the council meeting is a fully in-person meeting. All committees would be virtual, or sorry, hybrid, and all other meetings, informal subcommittees and so on, would be fully virtual.
Okay. Okay, it's now your vote's up in the chamber. Okay, Chief Executive.
Thank you, Chair. So there were 24 votes for, 5 votes against, so the proposal is carried.
Okay, thank you very much for that, Chief Executive, and thanks for everybody for their their patience and their voting and all of that. It was quite a comprehensive subject to get through, but at least hopefully whoever's back in the next term, there'll be some sort of a guideline there for us, or for whoever's back, and maybe something to help our chief executive and our officers move forward on. So, okay, I'm moving on now to the next report. It's actually on the correspondence. Just get clear my desk here. Okay, we're on to item 7, and that's correspondence. And I'll hand over to the Chief Executive, 7.1. Chief Executive.
Yes, thank you, Chair. Chair, this item of an update really was dealt with at the Health and Social Care Subcommittee on the 17th of February, but members will have seen that it's in the form of a response to the letter that we sent to the Trust on the 10th of February. So it's really for formal noting and reporting to this committee. So but members have had an opportunity to review. We did circulate it after the meeting as well.
Okay, members, you've heard it, Chief Executive. It is for noting. Can we have a proposer and second on a note? And it's Councillor Paul Robinson.
Opposed to note.
Opposed to note. Councillor Paul Stevenson.
Opposed to second.
Right, okay, proposed and seconded for noting. Councillor Diane Armstrong, you're gone. Thank you.
Yes, if I could, Chair, one question. Is it possible to raise just a query on page 2 concerning diagnostic radiology, which is something I had raised? It does not specify that the Trust has appointed the consultants at SWA. They've been appointed through international recruitment. Could I just please propose to seek clarity on that?
Okay.
That it is in fact for SWA. Thank you very much.
Thanks, Councillor Armstrong. Councillor Bell in the chamber.
I'm just very happy to second Councillor Armstrong's proposal, looking clarity there. Thank you, Chair.
Okay, are we all agreed? Thank you for that. Thanks, Councillor Armstrong. Okay, and we're now on to 7.2, and it's Nusra, and it's over to Chief Executive.
Yes, Chair, this is just in response to the Council's further correspondence that the methodology around the multiple deprivation measures be reviewed, and we'd expressed particular concerns regarding how rural areas were treated, and the correspondence states that in noting our concerns, but there's no intent to review the methodology at this stage.
Okay, you've heard Chief Executive. Proposer and seconder to note, please. Councillor Paul Stevenson, seconded by Councillor Roy Crawford. Okay. Agreed with the noting anyway, I take it. We have a couple of councillors coming in for furtherance, and that's Councillor Emmett McAleer via WebEx.
Yes, Chair. Obviously, this is another disappointing letter that we've received. It points, I suppose, to two things, and they seem to be recurring issues that we're dealing with. The first one being the issue around funding, and the second being around the lack of a functioning or operational executive to actually request or look at investigating that this be revisited. So again, it's yet another timely reminder for those that are currently huffing and sitting on the sidelines, maybe to get back to work and do the job they were put in to do, that they could maybe help to resolve some of these issues affecting our rural area. Thank you, Chair.
Okay, thank you. And up next we have Councillor Donald O'Coffey via WebEx.
Yeah, thanks, Chair. Yeah, I just reiterate the disappointment, but these multi-deprivation measures are actually hugely significant in determining the allocation of expenditure and public funding, and the fact that the current measure is genuinely, I would say, widespreadly understood to be biased against rural areas. For example, they can take a hefty weight resulting from eligibility for free school meals. And as anyone will understand, people who tend to have low incomes but who are maybe farmers are ineligible for free school meals under the current regime. And that this places quite a reduction in our deprivation under that index, and then that feeds through. And there's a number of these sort of mechanisms. They need to address them, because otherwise you're not going to get to the heart of rural deprivation as compared to urban. And the consequences of this is that areas certainly within Fermanagh, I'm sure in the same in Omagh, in rural areas have dropped down the worst league. It's a good thing in a way, but it doesn't reflect an actual improvement. It just reflects a change in the way the statistics have been conducted over 2 decades. And they're not willing to revise these. The powers that be obviously aren't willing to do it, but they are willing to change the electoral areas and the small areas within the statistics and producing new areas and zones. But they're not willing even to rebase, as we've seen from last night's meeting, the statistics from the last census, so that we can even have a meaningful comparison. So I think that this is very poor, and it is failing, in particular, the rural community. Thank you, Chair.
Thanks for your comments, Councillor Coffey. Next up, we have Councillor Seamus Green by WebEx.
Thank you, Chair. Yeah, just it's our statistics guy in the council give some reports. Yeah, Alan is right. Give a report on that, and something I didn't know, and I actually find it extremely hard to believe that this is the case. But the deprivation areas, once you're in a deprivation area, it doesn't change. There is no way of recording whether any of the things that's been used to help areas of deprivation is actually helping them and taking them out of it. So it seems to be, if you're in it, you're in it. And if another area's deprivation goes down, it's almost impossible to be then redefined as a deprived area. It's a really, really strange system. And the system in the south, whatever way they do it, and I'm just not technical enough or my memory's not good enough to remember, but whatever way they do it, it's a kind of a rolling system where they actually can track whether the measures that's been put in is actually working or not. But in the north, there is no way of actually tracking whether what they're doing is actually helping or not, which I find extraordinary. But that's the system we live in. And as Councillor Coffey said, it is really, really discriminating against rural areas, the system that we have.
Okay, thanks very much for your comments, Councillor Green. Next up, via WebEx, Councillor Dr. Josephine Dehan.
Thank you, Chair. And I have to say that I share other members' concerns in this regard. I feel that, certainly in the next mandate, and hopefully with the government institutions being hopefully restored by that point, I think that we should keep a watching brief on this and make further representations to the Minister for Finance for review of the methodology. NISRA have to be commissioned to do this type of work. It's important work. The programme for government previously emphasised the needs to look at outcomes. And how are we going to evaluate outcomes, particularly in very deprived areas, when we don't have the methodology to fully identify the areas where these deprivations are very high? So it is of concern. And I think that, for the new mandate, it's something that we really need to focus on and revisit at a later stage, Chair. Thank you.
Thanks, Councillor Dr. Dehan. Okay, it's been proposed and seconded for noting, and the various comments have been made. All agreed? Okay, on to item 7.3, and it's from the Western Health and Social Care Trust. Over to Chief Executive.
Yes, Chair, this is just in response to our letter that members had concerns that really asked the Trust to confirm how the existing domiciliary care packages are human rights compliant. So in response, the Trust have indicated that they wish to be helpful and to provide the information the committee requires, but given the breadth of rights legislation, they have sought some clarification really from us as to which particular articles or rights they would, our members would wish to raise specific concerns regarding, or to provide further clarity so that the Trust can investigate.
Thank you, Chief Executive. And we're going to the Chamber. Can we have a proposer, maybe and seconder to note, first of all, maybe? Councillor Warrington.
Thank you, Chair. Well, I'll propose to note, obviously domiciliary care within our council area is a big issue at the minute, especially in the more rural areas, where basically anybody that's working in the field can be travelling at least half an hour between patients or whatever you want to call them. So it's a big problem, and certainly I think the only way that it's going to improve is if the conditions is improved for the workers on the ground that's travelling numerous miles every day. Like, I went out one day quite recently and met two domiciliary carers, and I live in rural Fermanagh, and I met two of them on a back road that was very covered in snow, and yet they were out doing their job. So I think they need better conditions, better terms and conditions to do their work, because obviously the domiciliary care is very important to get people released from hospital when they're ready to go home, and free up beds and get people back to their own homes, where we all know everybody is men's better from their own house, but also get them home so that we can free up their hospital beds, because it's just log jammed, as we all know. Thank you, Chair.
Thanks. Okay, thank you for that, Councillor Warrington. Up next via WebEx is Councillor Emmett McAleer.
Thanks, Chair. Yeah, I'll second the noting of the letter, but just to answer the questions posed in it, and I actually would have to express some surprise that Mr. Guckian has had to ask, as obviously he should be fully across and indeed implementing all human rights articles which are enshrined in law and incumbent on every public authority to uphold. However, the particular articles in question which he needs to be focusing on in this instance are Articles 3, which obviously is an absolute, and Article 8, which is qualified, albeit in very exceptional circumstances. So I would be proposing that we return our correspondence and explain to him the articles that we are actually referring to in this particular item. Thank you, Chair.
Okay, you're proposing that a letter of return be sent again to Neil Guckian and emphasising Articles 3 and 8. Okay, and next up we have Councillor Donald O'Coffey via WebEx.
Thanks, Chair. Yeah, I'm happy to second the proposal from Councillor McAleer there. He's entirely accurate. I have to say, reading this response is, I believe when you get a response like this, you've asked a good question. And clearly it's a question that maybe the Chief Executive of the Trust does not want to necessarily put down an answer in black and white on, or at least he wants to stall. Frankly, it's obvious what the human rights implications are, and I would have thought that these would have been a priori consideration for the Trust in every regard to care. You know, it's a disgrace actually to receive this correspondence back from them. Article 8, as has just been referenced by Councillor McAleer, right to private and family life, and right to make choices for yourself, right to have your body and mind respected. Like, these are not difficult concepts to delineate or to address. And the fact that the Chief Executive of our local trust has come back with a communication basically questioning, asking us to clarify which of the human rights are we concerned that he's breaking or not delivering upon. I think tells its own story, and it is one that I'm hoping perhaps will get further development, whether or not it is something that he would like in the public sphere. So certainly, Chair, happy to second that. Thank you.
Thank you, Councillor Coffey. Now out of the chamber, we have Councillor Rosemary Barton.
Thank you very much, Chair. I'd just like to concur with everything that Councillor Warrington has said in regarding these domiciliary care workers. These are people that are invaluable in the community, invaluable in helping our perhaps generally elderly population be integrated back into our community after stays in hospital. And indeed, we've known from COVID over the past number of years with COVID and the pressure on hospital beds, the important role these people have to play in the community, And I do think we've got to look at their terms and conditions of service. Many of them are rushing from A to B, don't have time or anything else to spend with their clients. So all I would like to do is to second what Victor said. Thank you.
Thank you for your comment, Councillor Barton. It's already been seconded by Councillor Emmett McAleer. So I'm not seeing any other speakers on this. So it's been proposed by Councillor Victor Warrington and seconded by Councillor Emmett McAleer that we note the correspondence from the Trust. It's further been proposed then by Councillor Emmett McAleer and seconded by Councillor Donald O'Coffey that we write back to the Trust outlining Articles 3 and 8. Are we all agreed? Not seeing any dissent? Agreement? Okay, thanking you. On to item 7.4, and is from the Department of Education regarding provision of free school meals. Over to the Chief Executive.
Hey, Chair, so sorry, a couple of aspects to our original letter which have been addressed in the response. The first is whether there's an awareness in terms of schools regarding humanitarian grounds, and the letter sets out the mechanisms by which the department has referenced that to principals and boards of governors. And then the second element of the letter deals with, or our request was around the plan and strategy to enable a 100% uptake in free school meals. And it sets out really regarding the catering service improvement teams plans, and subject to approval, they should roll out for June to be implemented from September.
Okay, thanks, Chief Executive. And can we have a proposer and seconder on a note, first of all? Councillor Matthew Bell in the chamber.
Thank you, Chair, and I would happily proposed to note. But I do want to make a wee proposal on top of it, because I'm a little bit disappointed reading that they've admitted they don't have a strategy in terms of ensuring full uptake, and it's actually is still being developed. So I suppose at this stage the proposal will just be for the council to receive a request that the council receives a copy of it once it is developed, just so we can read over it and, well, feed into it once it is developed. Thank you, Chair.
Thanks, Councillor Bell. Okay, can we have a seconder for the noting? And seconder is Councillor Paul Stevenson for the noting. Councillor Barton, did you want to come in there? And secondly, Councillor Bell's proposal. Okay. Yeah, we're just going to WebEx now, and we have a couple of councillors coming in there, and there's Councillor Emmett McAleer via WebEx.
Yeah, Chair. Just I suppose speaking to a number of families about this particular issue, and I have to mention particularly one inspiring campaigner for a neighbouring district who I believe is actually tuned in to the meeting tonight. I have to say this item of correspondences and the information contained in the link is one that actually cannot be underestimated, and I think whilst we do get a number of letters and correspondence that are, hugely disappointing and disparaging towards the council and towards the local authority. The information contained within this is actually a very positive, and that's why I suppose when we were getting back to the department, we wanted to find out what the knowledge was. Now, the author of this letter has said that local schools, local governing bodies have been contacted on numerous occasions in relation to that. When you actually look at the link provided under discretionary provision in terms of the provision of meals and refreshments to school pupils, the authority may provide meals or other refreshment to pupils who are described or who would normally be in receipt of those meals on days other than school days. And the second point noted is that day pupils or every school day or other day school pupils who are not entitled to free meals, who attend whether it's granted secondary schools or primary and nursery schools, other than voluntary grammar and grant maintained and secondary schools, are also entitled to free school meals. So this is, I suppose, the crux of the matter, that my thinking behind raising this, and again, speaking to the people that I have been speaking, the families that I have been speaking to, is getting that knowledge out there, because families are enduring severe financial hardship and severe financial difficulty at present. There should be absolutely no stigma attached to availing of a service that is being provided for families that are in need, that are vulnerable, and that do have other concerns and other financial outgoings. And this is something that we, as a council, I suppose, I would like to see how we can investigate promoting this, again, whether it's through our social media channels, whether it's through our council magazine, because this is huge information. And I have to admit, it's something that up until I got involved in campaigning and working on this, it's something that I wasn't aware of. There's talk in terms of the provision of free school milk, I think, which I thought was done away with a few years back. But the document attached is really very interesting, and I think it is hidden away and that it's not well enough known. So I would like to propose, if possible, that council investigate how we can distribute and disseminate this information so that those who are in need and those who are vulnerable, not just in our district but in other districts, can actually avail of this service, which should be provided by the Education Authority. Thank you, Chair.
Thank you for that. I'll just bring the Chief Executive in to clarify.
Just one more minor point, Chair. We have no provision or scope to act outside of our district, so anything that we would do would have to be within the bounds of Fermanagh and Omagh.
Okay, for that clarification there, Councillor.
Just very briefly comment. Yeah, I'm happy, completely understand that. I suppose my thinking is that if we promote it through our channels, that the same information would be applicable across the board, because it's the Education Authority as opposed to something more local than that. So that was my logic, but I appreciate what the Chief Executive is saying there.
No problem. Thank you. Next up, via WebEx, we have Councillor Dr. Josephine Dehan.
Yes, thank you, Chair. And I would like to second Councillor McAleer's proposal, Chair. You know, in my view, the main barrier to accessing free school meals is lack of information about entitlements, about the application process. We did previously have a long discussion in Council about the fact that applications for free school meals were made online, and many families were not aware of this and didn't have the resources to complete applications online, resulting in many needy families being excluded from free school meals. Our main concern, Chair, is that our children do not go hungry and that they are provided with a nutritionally adequate meal during the day. Now, Chair, you will recall, members will recall correspondence from Dr. Brown in relation to cost-saving measures, and he referenced these new menus. And I have concerns about that, Chair. I mean, this letter states that there has been extensive engagement with pupils and parents and teachers to make the menus more attractive and to market the menus and to focus on non-pricing issues. But I mean, I personally would want to seek assurances that the menu on offer is one which will provide a nutritionally adequate meal. Those of us who have children will know that often a child's preference will not necessarily be one that is nutritionally adequate. So I would like to propose that we write back to Margaret Rose McNaughton seeking clarification on whether or not there has been liaison with dietetics and nutritionalists regarding the adequacy of these menus, whatever about marketing strategies and so on. My main concern is that children would have a good meal that will sustain them throughout the day. So I just want that information as to the nutritional quality of that meal. Dr. Brown's letter suggested that there were cost savings to be made by altering the meal provision, and I would like clarification on how those savings are made, and I sincerely hope it's not at the expense of a good nutritious meal. Thank you, Chair.
Thank you very much, Councillor Dr. Dehan. Next up via WebEx, we have Councillor Donald O'Coffey.
Thank you, Chair. Just in regard to this, I would totally agree with the statement that's just been made there by Councillor Dehan. What's clear here is that that there is the mechanism in place for all children to be afforded access to a nutritious meal at school. The actual cost of providing it due to economies of scale would not even be that significant, really. And it has to be said that this letter, as Councillor McAleer points out, actually clarifies that there are mechanisms in place to extend free school meals to those who are not closely entitled to it as per the conditions. However, the reality is that schools are struggling to even perform the basic educational roles that they are required to do. Schools are asking parents for toilet rolls, and yet the mechanism exists within the schools to transform the lives of young people. What better way to transform the life of a young person than to enable them to have a decent meal at school so that they can develop their minds and physiques and so on, and develop as humans and have the best possible start to life. Yet today we hear of £11 billion to be spent on the armaments of war. We've billions of pounds being spent on nuclear weaponry, which hopefully will never be used. But surely, if our society was prioritising what would matter, we would be providing free school meals to every child in our schools. And I think that is the only conclusion of any humanity that we can draw. So I just think that this is opening the door to a potential mechanism, and I just want to reiterate the points that Councillor Dehan has raised there. I raised them the previous night, that the emphasis appears to be to idea of we're going to increase attractiveness of free school meals and make a cost saving in the practice, and I don't believe that the two things, frankly, are at all achievable. Thank you, Chair.
So you're seconding Councillor Dehan?
Indeed. Thank you, Chair.
Okay, thanks very much. Okay, there are no further speakers, so that was for the noting. It was proposed by Councillor Matthew Bell, seconded by Councillor Paul Stevenson for noting. We were all agreed there. Further to that, there was a proposal from Councillor Emmett McAleer that we disseminate information throughout within the council area, and that was seconded by Councillor Dr. Josephine Dehan. And the third part of that was that Councillor Dehan said that we would write back seeking clarification regarding the nutritional quality of the meal and the meal savings. I think I've got that right. And that was seconded by Councillor Donald O'Coffey. And those proposals, are we all agreed? Sorry, Councillor Bell, come on now.
I believe I made a proposal as well.
Just clarify it.
It was
a copy of the strategy.
Yeah.
Yep. That's
Thank you,
done.
Chair.
Okay. And that was seconded by Councillor Barton. All agreed? Okay. There's quite a bit of debate on that one. So. Okay, we're on now to 7.5, and there's no correspondence from the Divisional Roads Manager, Western Division. And over to the Chief Executive.
Yeah, thank you, Chair. This really follows on from our special council meeting, and there were a number of individual member queries that the department agreed to follow up on. So the details provided there, Chair, together with an invitation to contact either the Divisional Roads Manager or either of the section engineers for further information.
Okay, can we proposer and seconder to note? Councillor Paul Robinson's
Proposed note.
Proposed to note, seconded by Councillor Alan Rennie for noting. Okay, and we have by WebEx, Councillor Emmett McAleer.
Thank you, Chair. And I'll be very brief on this one. Just I'm not sure how they decided which councillors they were going to answer, but I know that in the minutes, certainly the minutes of that meeting, I had a couple of queries that were outstanding that were to be got back on, but I'm happy enough to chase up in my own capacity at a later date. Thank you.
Okay, thank you. Okay, it's been proposed and seconded and noted then with the comments, obviously with Councillor McAleer there. We're all agreed? Thank you. On to item 7.6, and it's the note details of an NAC UK conference, Royal Hotel in Scarborough, 14th to 16th April 23. Chief Executive.
Thank you, Chair. This is just, as you've indicated, in April 14th to the 16th. The cost for attendance is £350 plus VAT plus travel plus accommodation. So I'm assuming chair members would just wish to note.
Thanks for that. Mr. Warrington.
Proposed note.
Okay, B. Warrington noted. Mr. McGuire.
Second that proposal, Chair.
Okay, it's been proposed by Councillor Warrington and seconded by Councillor McGuire that we note. All agreed? Thank you. Now on to item 7.7. It's the no correspondence dated the 10th of March 23 from the Secretary of State for Northern Ireland regarding the King's coronation. Chief Executive.
Yes, Chair. This is relates to funding availability should local authorities wish to provide big screen events for the screening of the coronation on the 6th of May. And there's also potential funding for if you wish to screen the Eurovision Song Contest the following weekend. So we don't have proposals for either, Chair. So I just recommend we be noting, please.
Okay, you've heard the Chief Executive or proposal and second on a note. Councillor Robinson, or no, sorry, Councillor Paul Stevenson.
Proposed to note, Chair.
Right, okay, and seconded by Councillor Alan Rennie. Councillor Emmett McAleer wants to come in via WebEx.
Yes, Chair. Again, just through yourself, a quick question for the Chief Executive. If a group wished to provide a screening of the Eurovision Song Contest, how would they go about doing that? If we're just noting it tonight, do they contact the council directly or work through a councillor, or what would you advise just in relation to that? Thank you, Chair.
Chief Executive.
No, Chair, just to clarify, this funding is only for local authorities, so it would be if councils themselves were taking forward communal activities. Individual groups would just have to look at, I suppose, community sponsorship. The National Lottery will be doing awards for events associated certainly with the coronation. Potentially, I don't know if Eurovision is included, but it would just be normal grant aid streams. But this particular funding is specific for local authorities.
Okay, thank you. Now we're on to 7.8 and it's down to other correspondence. Now bear in mind, Thelma, our Head of Human Resources, has already dealt with two pieces there. And Chief Executive, 7.81.
Yes, Chair. So 781 is a response from the Permanent Secretary of DFC regarding the rate support grant allocation, acknowledging the difficulties in which the Council finds itself and indeed recognising the importance that this grant was to councils, but given their financial pressures, there's not going to be a review. And obviously, even in the budget announcements today, it's unlikely that the situation is going to improve.
Okay, can we propose and second a note? Councillor Roy Crawford, seconded by Councillor Paul Robinson. And agreed. Thank you. 7.83 we're on to now.
This is just a notification of a notion, a notice of motion around the reduction in the voting age for Newry, Mourne and Down. So normally, Chair, we would note motions adopted at other councils. So again, we'd be recommending the similar approach tonight.
Proposed and seconded a note. Councillor Maguire, seconded by Councillor Baird. Agreed? Okay, thank you. On to item 7.84.
Yes, Chair. We just received this today. So this is the formal notification from the PAC regarding the next stage or the commencement of the public inquiry into the A5 Western Transport Corridor Scheme. So just to note, the proceedings will reopen on Monday, the 15th of May, which is obviously the week of the election, and the details in terms of the Commissioner, the representations are set out. Obviously, Chair, we have made representations previously. Would just be seeking your approval that we would restate the Council's continued support for the A5 and the urgency in getting this scheme progressed. And other than that, just to note, I have one related matter, Chair, when that's dealt with, that I could just comment on here, please.
Okay, you've heard the Chief Executive proposal and seconded and noted. Councillor Alan Rainey, MBE, seconded by Councillor Roy Crawford. And all agreed. Chief Executive.
Yes, Chair, just to advise at last night's Regeneration and Community Committee, there was some discussion regarding the informal meeting with Enough is Enough, the A5 campaign group, and to see if the status of the meeting could be changed. Because the decision was taken on the 3rd of February, we'll be within our 6-month period, so we can't change the status of the meeting now. So we will be proceeding with the informal meeting as scheduled. However, should members wish, again, it will be in the new mandate for a further formal meeting that could be considered at that stage. So just to clarify on that basis.
Okay, you've heard the clarification from the Chief Executive. All agreed. Just a proposal and second and a note. Councillor Robinson, seconded by Councillor Paul Stevenson. All agreed? Okay, on to 7.8.6, Chief Executive.
Yes, Chair, this is an update from the Department of Health regarding Brookborough and Tempo practice, and just confirmation around the intention for the contract to be returned, the intention to cease service provision at the end of August, and the department will proceed to instigate the arrangements to get that contract let, and also a willingness, Chair, for departmental officials from the SPPG to meet with the council. So we will try and get that progressed with some urgency, because I imagine they won't be in a position to meet once we enter the period of pre-election sensitivity. So we'll update you accordingly.
Okay, can we propose and second and a note? First of all, Councillor Warrington.
I'll propose a note, and certainly we want to see a resolution in Brookborough and Tempo, because I know there's a lot of concerned people around there at the minute. So hopefully we can get something resolved quickly. Thank you.
Thank you. Councillor Warrington, you're proposing a note also. Councillor Eamon Keenan.
Thank you, Chair. Yeah, I'll second the noting of it. But I do know that Peter May said he wishes to reassure the patients that the service will continue the next 6 months. Sort of deja vu, similar letter sent to Maple Group a few months ago by us and received a similar reply. Last night there was a 15-minute slot on UTV News about this ski practice, and it's there's 2 doctors left. It's been reported, and they are fearing the collapse of the service locally. And Dr. Mason, who's with the GP Royal College of Surgeons, is fearful that the collapse of GP service are going to happen across the north, and that the likely outcome is a 2-tier service, she said. So this has been something that myself and others have actually been concerned about, and now it looks like there isn't a likely outcome of this. So I'll propose a second and note of it. Yep.
Thank you very much, Councillor Keenan. And back in the chamber again, Councillor Paul Stevenson.
Thank you, Chair. Yeah, very disappointing to see this happening, especially with Liston Ski having the problems that they did have now. Brookborough and Tempo hitting the same trail, as the saying goes. Not good for our constituents in the area. And I mean, like, even on what we were talking about last night, and the rural transport maybe going off too, it's another blow to the people of the area. Thank you, Chair.
Thank you. And over to WebEx now, and we have Councillor Dr. Josephine Dehan via WebEx.
Thank you, Chair. And we certainly this is very concerning, and we certainly hope that another contractor can be found. I am aware that SPPG and the GP federations have been working hard to address these issues. Nevertheless, the basic fact remains that there are simply not enough GPs who are willing to come and work in our rural areas. And the situation is not helped by the fact that our main hospital, the Southwest Acute Hospital, that there are proposals to suspend emergency surgery there. And obviously GPs will want to work in an area where they can have ready and safe access to the full range of acute services. So that situation doesn't help recruitment of GPs. And Chair, as you will be aware, over the last couple of years, this council has lobbied very hard for the introduction of multidisciplinary teams to GP practices in the Southwest GP Federation. And sadly, as yet, they have not been put in place. So it's very disappointing. It is my view that primary care has not received the support that it deserves. And what we're seeing now is the outworkings of that lack of investment and lack of care. Sadly, the demand for primary care services far exceeds the ability of GP practices to provide those services. And I fear that this is the tip of the iceberg, and that we are going to see many more practices in similar situations. Thank you, Chair.
Thanks, Councillor Dr. Dehan. Next up via WebEx, we have Councillor Donal Coffey.
Yeah, thanks, Chair. I would entirely concur with Councillor Dehan there. The fact that primary care receives a lower proportion in Northern Ireland of total health expenditure than any other part of the UK is a disgrace. One of the consequences is that the rural areas, and you can't get more rural than Fermanagh and Omagh, are suffering the worst GP crisis in the UK. And the reality is that if anywhere the NHS provided system which has contracted GPs is going to break first, it's going to be in Fermanagh and Omagh. And all the points Councillor Dehan has are spot on. We've waited decades for investment in primary care centres which haven't been built as yet. We have no infrastructure to accommodate the multidisciplinary teams. The GPs in our area not only have to deal with all the other problems a rural GP has to deal with in terms of insurance and responsibilities and trying to recruit and manage a small business, but they also now have the onus and the huge responsibility that comes from having to work around the absence of locally accessible urgent and emergency surgery at SWA. And I think that all of these things are really creating a total crisis in our system. The one issue I would disagree with Councillor Dehan on is that I and many, I see increasing numbers of GPs are agreeing with this, that the way to resolve this is now to bite the bullet, so to speak, and for GPs to be directly contracted by the NHS to deliver a GP NHS service. Now, maybe that's not exactly to everyone's liking, but it's the only solution I can see that will actually work for rural communities. And unfortunately, if we don't do that, we will see a situation where either communities are forced by dint of necessity to go private and pay to see GPs, which is unfortunately already happening, or we will see the situation where they lose access altogether. So thank you, Chair.
Thank you, Councillor Coffey. Okay, it's been proposed and seconded for noting. We're all agreed with the comments that have been made. Okay, on to item 7.8.7, Chief Executive.
Yes, Chair, and similar issue, but this relates specifically with Maple or to Maple. So two aspects to our original request, Chair, around the identity of the new contractor. That's not yet known, but the department said they will provide those details to us when they're confirmed, and then an update is provided regarding the health centre in Lisnaskea. The proposed building and advising that they're hoping to commence construction in January, February 2024 with operational commencement in 2026.
Okay. Thank you. With that, Chief Executive, for proposer and seconder to note, Councillor Warrington.
Thank you, Chair. Well, I'll propose to note, I suppose we're welcoming the new health centre for quite a while now, and I suppose we'll only really be happy when we see the first digger in on site actually planning it out. It was good to see that the trust is working closely with the Educational Authority to complete the site purchase, and this should happen before the financial year. And financial year to me ends in a couple of weeks' time, so hopefully that will that'll happen, because this has been dragging on and on and on. And certainly is something that I've been involved in as an Earnings councillor, probably not that long into the new super councils back in 2014. So I'll propose to note. Thank you.
Thank you, Councillor Warrington. Next up, we have Councillor Paul Robinson in the chamber.
Thank you, Chair. I'll second the noting. But see, that the early 26th, they're reckoning, before it'll be in operation. By that time, it could be out of date, the time it gets built, you know. Not as modern then as what would be now. This is the problem with some of this, the government departments. The time they get the building built, not there, they're out of date. It takes them that long getting anything done. So, thank you, Chair.
Thanks, Councillor Robinson, for that. And it's proposed by Councillor Warrington and seconded by Councillor Robinson for noting. And we go to Councillor Eamon Keenan in the chamber.
Thank you, Chair. The previous speaker's quite correct. 2006 it was discussed. I think almost 20 years from first discussed about doing this. That'll be 20 years time it started or finished. But the worry is, will there be doctors to work in it? Maybe it doesn't look like they're going to be too many. There's not too many at the minute, but if you get the right large private provider, I'd imagine that's what the wait is for. But that's all I have to say on that. Thank you, Chair.
Okay. Thanks, Councillor Keenan. Proposal and seconded the note with all the comments. All agreed. Okay, I think that deals with that piece. It is now my decision to go on to part 2 business. Because the interest of time, it's almost 9:15. We'll try and get this dealt with here. So Adam, if they can, proposer and seconder to go into confidential. Councillor Paul Robinson. seconded by Councillor Matthew Bell. Not agreed? Yeah. Hold on just. Can you give us a shout when we're ready to go, Adam? Okay, thank you, Adam. Okay, we'll ask now, we'll bring in Thelma, our Head of Human Resources, to give us a resume of what took place whilst in committee.
Thank you, Chairman. So while in committee, the committee considered matters arising from the previous Policy and Resources Committee confidential minutes, of which there were none, and also considered confidential report on confidential financial matters and, of course, confidential report on staff matters, and the committee accepted the recommendations contained in both reports.
Thank you for that, Thelma. Can we have a proposer and seconder? Councillor Paul Stevenson, seconded by Councillor Alan Rainey. I could see your hand going up there, Councillor Rainey. And agreed. Thank you. Thanks, Adam, for keeping us right there as well in this. We are now going to go back to item 4, and that is the matters arising from our Policy and Resources Committee meeting on Wednesday, the 15th of February 2023, and this is matters arising. So page 1, page 2, Chief Executive.
Thank you, Chair. Just at the top of page 2, St Mary's Primary School, 5 Mile Town, just to note receipt of correspondence from the Education Authority, the details set out regarding the development proposal, notifications, and members will be aware we have approval and have made a response to that process, supporting the retention of the school.
Okay, proposed to note by Councillor Paul Robinson, seconded by Councillor Paul Stevenson. All agreed for noting. Still on page 2. We've already dealt with those other issues.
Sorry, just to highlight, Chair, the letters linked to the subsequent resolutions about Maple Healthcare and the Lisnaskey, we dealt with another correspondence, or the consideration of correspondence.
Okay, that's page 2, page 3, page 4, page 5, page 6, page 7, page 7.
Okay, no, Chair, just to remind members just regarding the year-end declaration requirements, 22-23 financial year, you've been emailed regarding that, and just to remember the deadline for submission is as soon as possible and no later than Monday the 20th of March. So if we could ask you to attend to that, please.
Okay, you've all heard that, councillors. Get your returns in. Thank you for that. Still on page 7, page 8, page 9, page 10, page 11, Chief Executive.
2 items on page 11, Chair. Firstly, to remind members that we, tomorrow afternoon or tomorrow evening at 5 p.m, we have the informal meeting with Northern Ireland Ambulance Services, and the Chief Executive, Michael Bloomfield, and the Assistant Director of Operations, Kieran McKenna, will be in attendance. The second item, Chair, is a piece of correspondence linked to the previous concerns regarding Southwest Acute Hospital. So this is a response from the Henry Reeve, really the Cuban Medical Brigade, and they have asked if the council would provide as much detail as possible regarding the request for medical standards to be met, or staffing standards to be met at the Southwest Acute Hospital.
Okay, I see people wanting to come on here. Councillor Eamon Keenan in the chamber. Oh, knock myself out here.
Thank you, Chair. Firstly, I'd like to welcome the letter from Marta Castillo of the Trade and Economic Affairs Department of the Embassy of Cuba. It's great to see such a positive response from a government department whilst looking for help here in Fermanagh. It's not something that we've been used to recently, but I never any doubt when I first request that we seek help from the Cuban doctors that they would take our request for help seriously. I knew with their past actions, I knew with their solidarity in general, and that they'd be willing to help us. And as a Cuban friend of mine, Bernardo, once said, he says, Ireland, the people of Cuba and the people of Ireland have a very, very special friendship. So I knew there'd be no problem to help. And this letter shows that. Cuba, a country living under heavy US economic sanctions, is able and willing to send medical support to us, the poor people of Fermanagh living under the yoke of imperialism, and who are now in the situation that we may not even be able to receive adequate life-saving medical treatment when needed. Anyway, Marta said she has submitted her request for help, and in the meantime, she would like details of the specialities that we may need. From my memory, we need 5 general surgeons, a gastrointestinal surgeon, a cardiologist, a renal surgeon, an endoscopic surgeon, a rheumatology team. There may be others that we probably need, but I think we should avail of the offer for a video conference and invite Mr. Neil Gookin and his team to attend, and I'd like to make that a proposal. And I also propose we write back to Marta and give her the listed specialities and let her know we'll be making contact with the Western Trust to organise the video call. I also propose that we let Neil Gookin make him aware of this letter and, as I said, invite him to the call with Marta and our Cuban colleagues. I do note that on the correspondence 7.1 we dealt with earlier on, the thrust refers to advertising internationally for the positions. So this offer, hopefully from Cuba, for the possible medical support should hopefully be seen by the Trust as a big opportunity, and of course an opportunity for the people of Fermanagh on their own. Finally, I would like to include on the letter to Marta our very, very sincere gratitude for her and our country's response for help in our hour of need. Our country's health service and record of solidarity is a shining light all over the world, and I think that we as a country could learn a lot from the Cuban health system and the political system in general. Thank you, Chair.
Thanks for that, Councillor Keenan. And the Chamber again, Councillor Alex Baird.
Yeah, thank you, Chair. Just something anecdotal. During January, I was away on holiday and I met several Cubans and I was interested in talking to them. And they verified that they had a wonderful health system, but they also verified that the reason they had left because there was starvation, they were hungry, there was rationing. So I did a bit of research on it.
There's no food banks there.
I'm looking at Mr. Google here, and now I may be accused of being quoting neoliberals, but quotes from the World Food Programme, ABC News, France 24, talks about rationing of food and shortages of food. So I don't want to take away from the efficiency and effectiveness of the Cuban health system, but maybe they'd be better staying at home dealing with the problems that they have with their food shortages. Thank you, Chair.
Thanks, Councillor Baird. Back in the Chamber again, Councillor Matthew Bale.
Thank you, Chair. I just couldn't let a comment by Councillor Keenan go. I wasn't aware he was anti Good Friday Belfast Agreement, and in the 25th year of the agreement, which has brought peace to Northern Ireland, I can't believe he's still going down that rhetoric. I'm a great believer in the Belfast Agreement. I haven't had to grow up with fears of shootings and bombings, and I think Councillor Keenan needs to realise that the Belfast Agreement was agreed by over 70% of the people of Northern Ireland and acknowledged Northern Ireland's...
Right, that's it. We're nearly finished here.
Chair, I will clarify that. You said the imperial yoke. Ireland is under
over the top of each other.
Ireland is under the imperial yoke. The Belfast Agreement outlined very clearly Northern Ireland's rightful place within the United Kingdom. So if you do wish to be anti-Belfast Agreement, at least be clear about it. Thank you, Chair.
Thanks for your comments. Over to WebEx now. We have Councillor Emmett McAleer.
Thank you, Chair. Yeah, from the sublime of the letter to the ridiculousness of the last couple of comments, I'm not even going to respond to that last one. I can't see the relevance whatsoever. And as for requesting that the doctors or medical staff should stay in Cuba to feed poor people, I can't see the joined up thinking there whatsoever. I'd like to second Councillor Keenan's proposals and definitely welcome the response from the Cuban embassy. I'm happy that Councillor Keenan has actually outlaid some of the provisions that we are requesting, and indeed has proposed that we do informally meet with Marta and the team, and has included again the Western Trust. So hopefully we can get some work and some progress made on that. Bearing in mind the time, I'm not going to dwell on this, but I would just conclude by taking issue with the letter that we sent as a council, which is addressed Dear Sirs. And I think I would like to request that we're more mindful of being inclusive when issuing further correspondence on this, or indeed any other correspondence we may send, especially when we have, obviously we're not unsure of who we're actually sending or addressing correspondence to. So that was the one disappointing thing in all of this, Chair, apart from a number of the comments. Thank you, Chair.
Can clarify that position?
Yes, Chair, happy to clarify. We actually sought both guidance and advice from the Henry Reeve Brigade. We sought details as to the nominated officers and were advised that Dear Sirs was the appropriate expression of communication when engaging for the first time with the Henry Reeve Brigade. As members will know, our general approach is when we have a named first point of contact, that is what we would use. And if there is any doubt at all, we would certainly phrase it differently, but that was the advice received.
Okay, thank you, Chief Executive. I'm going to allow very quick comments from Councillor Warrington on the Chamber and Councillor Donald O'Coffey via WebEx, because we're coming very near the end of our time here.
Thank you, Chair. Well, as much as this response is all very glowing and makes good reading, can any of us really realistic see Southwest Acute Hospital's problems being solved by the number of consultants that we need coming over from Cuba? You know, certainly anybody that will come over from Cuba, they're not going to come over on a permanent basis. And let's be honest with you, we want doctors on a permanent basis, not doctors that are going to come over today and be away home in a couple of weeks' time. As I say, it all looks great on paper, and it might satisfy some of our individuals, but certainly I would like to be seeing more permanent answers to our problems and not a sticking plaster over them, which is all I would see this response from Cuba. Thank you.
Okay, thanks for that, Councillor Warrington. A very quick comment there, Councillor Donald O'Coffey via WebEx.
Thanks, Chair. Yeah, I have to say that this is a very shining light of humanitarian concern from a country that's under blockade. They don't have food banks, maybe. That's the one thing they don't have that we have. But it has to be said that I don't understand how any councillor could look such generosity and almost take this approach that it's condemned and use as another opportunity to attack a third world country who's trying to do their best. But I just in regard to the full-time positions, yes, of course, we want full-time positions. And yes, of course, any provision that they could give us would be probably temporary. It may be a few years, and in which case it may stabilize the situation. What we have is a really severe crisis, and anything we can get at this stage is something we should welcome as a community. Thank you, Chair.
Thank you. Okay, that's brought that to conclusion. Councillor Keenan made like 3 proposals there, all rounded onto the one, and it was seconded by Councillor Emmett McAleer. Maybe Chief Executive, maybe if you can clarify all of that, and then we'll go to a vote.
Okay, Chair. So firstly, the correspondence be noted that we respond expressing our sincere gratitude for the offer of assistance, advising that we would wish to avail of the offer and setting out the requirements as summarised by Councillor Keenan in terms of the various positions, surgeons, rheumatologists, renal surgeons, so on, that we would proceed to arrange, accept the request of a video call, and that we would proceed to invite the Western Health and Social Care Trust Chief Executive to that meeting, and also to forward a letter of the correspondence received to the Trust for their consideration and information as well.
Okay, you've heard it outlined there, the proposal by Councillor Keenan, seconded by Councillor McAleer. Are we all agreed? No dissent? Okay. Councillor Warrington.
I would just have a query. In that proposal, we're talking about setting up a video call. What is the chances of the Trust? And at the end of the day, the Trust has to be the people who spearhead this. We can't go as a council to talk to the Cuban people about getting medical staff over to Fermanagh to fill our vacant posts. And surely would need to certainly check with the trust, first of all, if they're willing to meet or willing to go onto a video call, which I would be, I don't know what their response would be to that, but certainly I think if Councillor Keenan maybe would refine his proposal that we contact the trust first and foremost, I think would be a better situation. Thank you, Chair.
Thanks. Chief Executive.
Well, sorry, Chair, obviously if Councillor Keane wished to do so, I suppose what I was just going to say, I thought the proposal was we would proceed regardless, and if the trust, certainly invite them, but whether or not the trust would attend, we would proceed with the call, but Councillor Keenan may wish to clarify further.
I'm not having a debate on this, Alex. Sorry, Councillor Keenan.
Yeah, I'll stick with the original proposal, yeah, to move forward that way, as we are basically letting them know we're going to accept that whole time and organise a meeting with the trust. Thank you.
Right. Very quickly, Councillor Baird. Very quickly.
Oh, so thanks. I thought you were barring me.
Well, I was going to bar you.
Maybe it's my last goodbye. No, I think the principle, where's the chicken and the egg in this? Well, there's not much point in us going down this route, inviting those people that we think that's needed. If the trust, in principle, are not prepared to accept them, if there's barriers to be created or to be got over on qualifications, and I can't support that unless I think we're wasting our time until that. Sorry, I think that there's an echo coming from somewhere. Unless the trust were prepared to do it, I'd be happy enough if the trust were, but I don't see any point unless the trust are involved.
Thanks for your comments, Councillor Baird. Councillor Keenan's clear on his proposal. It was seconded by Councillor McAleer. So I have already put it to the people. There was no dissent at the time. Councillor Warrington and yourselves have queries. They've been answered. I'm not bringing down Councillor O'Coffey in again. So there's no dissent. So that's okay. We'll just carry on. Matters arising again. We're running fast out of time here. Page 11, page 12, and page 13. Okay, Councillor Debbie Coyle, just with regard to your items of any urgent and relevant business, I've discussed this here with the Chief Executive, and she's advised if you could put those questions to her via email, or the Chief Executive may contact you with regard to that. It's just we're fast running out of time here. Is that okay?
That's okay. I had actually written to John Boyle regarding the electric charging point in Beleek, and was advised to bring it to get it passed through the committee, but I'm happy enough to send it straight to Alison if that's okay.
Oh, thanks for that, Councillor Coyle. Just before we close, this is my last meeting as chair of Policy and Resources Committee. Can I just thank everyone for their cooperation, especially this evening. We've got it all done, bar those couple of items there in any urgent relevant business. Can I thank Chief Executive and her team around the table here, and also Heather, who's typing away there, a good one. Thank you very much, and Adam on IT. And I want to thank everybody for the cooperation all year long, and we don't know who's going to be back here the next time. So thanks. Meeting is now closed.
Thanks, Chair. Good night.
Good night.